Good evening, everyone. APTA invites Siragrandhi, a national level paper and poster presentation. And once again, I invite everyone to the second day of paper and poster presentation. And before starting the session, I would like to invite all our respected panel members. And without any delay, we can start the session today. And before that, dear participants, your maximum time limit is 8 minutes. So first, we have a paper presentation. And I invite Dr. Amrita Bhausaheb Bankar.
Good evening, everybody. Myself, Dr. Amrita Bhausaheb Bankar from SVNST Ayurved College, Rauri. My topic is study the add-on effect of Sharjala in the management of Siragrandhi Janya Dushtabran, venous ulcer, guided by Dr. Anant Kumar Shikokar, PhD holder, HOD, Shala Department, SVNST Ayurved College, Rauri. Title: Study the add-on effect of Sharjala in the management of Siragrandhi Janya Dushtabran, venous ulcer. Introduction. Acharya Sushruta, the father of Indian surgery, has explained Vrana in his Sushrut Sahita. Vrana is defined as an injury to the body in the form of violence, road traffic accident, surgery, and various underlying pathological conditions that typically involves abrasions or leaking of skin layer and usually is associated with damage to the underlying tissues. In today's surgical practice, traumatic wounds are easy, cost-effective, and easy to cure as compared to pathological ulcers which are not easily cured. So pathological ulcers, especially Siragrandhi Janya Dushtabran, venous ulcer, is a challenge for early, easy and safe cure. Venous ulcer arise from venous wall incompetence and calf muscle pump insufficiency, which leads to incomplete venous return and further progress in venous stasis and result in microcirculatory changes and localized ischemia. As the presence of constant etiological factors, the pathological changes result in venous stasis, which cause dilatation, elongation, tortuosity, and circulation. Continuous but slow molecular death of cells, that is necrosis, occurred due to precondition of venous ulcer like lipodermatosclerosis, sign of ischemia, eczema, etc. The clinical diagnosis of venous ulcer is easy with simple observation of 3 years: site, shape, size. Further confirmation of venous ulcer carried out with history, examination, and laboratory investigations, but to decide the extent and prognosis of ulcer, color Doppler radiological investigations are necessary. In present era, the modern surgical management mostly based on non-surgical treatment like avoidance of aggravating factors of compressive bandage, oral medications, diazepam and calcium dobucillin, cleaning and dressing of ulcer with various antiseptics and wound healing promoting medicaments and sclerosing agents, pilodocanal with local injection therapy. The surgical management of venous ulcer is highly expensive, require longer hospitalization, untoward complications, and non-availability in rural areas. So non-popularity and non-acceptability of surgical modalities observed in population. So keeping above fact in mind, in today's surgical practice, the management of venous ulcer done with conservative managements like avoidance of aggravating factors, compressive bandage, oral medications, diazepam, and cleaning and dressing of ulcer. The end result of this management shows satisfactory improvement in venous ulcer, but this requires longer duration for the complete epithelialization of venous ulcer. In last 2 decades, integrated research was carried out for the venous ulcer in India and abroad. This integration, especially with modern conservative oral medicine, diazepam, and lease therapy, Jalakaucharan, shows early progress in healing of venous ulcer with cost-effective, no hospitalization, no untoward effect, and complete cure of the ulcer. But cleaning and dressing of ulcer is challenged in the management of venous ulcer because maximum cleaning and dressing medicaments are expensive, irritative, requires expert supervision. In Sushrut Sahita, wound management deals with various 60 upakramas, but Shara therapy is the magic remedy in the critical wound condition. Unfortunately, direct application of Shara is practically not acceptable by patient and medical experts, but it is highly corrosive, irritative, painful, intolerable, and cause healthy granulation tissue damage of the ulcer. So to solve the above difficulties, we have discussed how to lower the corrosive action pH of Shara that will make it acceptable by patient and medical experts. We formulated Shar Jala, Shar powder plus distilled water in the form of 1:100 and shows acceptability with efficacy of Shodhan and Ropan properties in the management of venous ulcer as a cleaning and dressing modalities. Effective management of venous ulcer is possible with integration of medicine. So we have arranged add-on effect of Sharjala with tablet Teflon and leech application in the management of Siragrandhi Janyadushtavan venous ulcer. Case study. Now I am explaining a case study of venous ulcer which treated with oral medicines diosmin 500 mg BD, leech application once a week, and local application of Sharjala 20 ml daily. The above trial was given to venous ulcer patient for 30 days. A male patient of 45 years residing at Rauri, working as a worker in hotel with low socioeconomic class, came in Shalatantra OPD on 27 September 2021, having a cheap complaints of total swelling in right lower limb since last 6 years, pain in right lower limb since 2 years, ulcer on the lower 1/3 of right leg since last 8 months of the size 4 centimeter into 5 centimeter. Origin, duration, and progress. Patient was asymptomatic before 6 years, then he developed a small size tortoise swelling in the right lower limb, which gradually increased in size and extending upward of thigh. The patient ignored the above condition and then developed evidence of ulcer at right lower limb above the middle malleolus with pigmentation, itching, and oozing. Patient had consulted private doctor and was advised electrocrep bandage and oral medicine, calcium dobucillin, and local application of antiseptic ointment, providing, and multivitamins, but the ulcer did not heal properly. After that, he came to SVNST Ayurved College and a hospital in Shalatantra OPD, and detailed history examination investigations were carried out to assess inclusive and exclusive criteria and selected for the present clinical trial of oral medicine, diosmin, electrocrep bandage, leech application, and local cleaning and dressing of ulcer with Sharjala. Methodology. Daily wash was given with the NS, informed and written consent taken, tablet Deflon 500 mg twice daily orally given, and standard operating procedure for Sharjala below. 20 ml of pre-prepared Sharjal is taken in airtight bottle in the syringe of 20 ml, and the wound is washed thoroughly daily once morning for 30 days. Application of leech weekly once, sterile dressing daily, elevation of affected limb at night. Observations were noted every 7 days. Methods of preparation of Sharjala. Apamargashar. Whole plant will be collected and cut into pieces. After drying, the plant is in shade. It should be burned on light fire. Ash is collected and dissolved in 6 times of water. Solution so found is filtered with help of percolator. Residue ash is again dissolved in 4 times of water, and the same procedure is repeated at least twice in order to take away all the alkaline material from ash. Ultimately, the ash remains as a neutral residue which should be thrown away. The fluid will be filtered several times, and finally the Shara obtained by evaporating the filtered solution. Distilled water used in preparation of Shara obtained from the distillation apparatus from research laboratory of present research institute. Procedure: 1 gram of Apamargashar will be mixed with 100 ml of distilled water and soaked overnight in jar. In this way, 1:100 proportion of Apamargashar and distilled water respectively will be mixed and sealed in plastic bottle having capacity of 400 ml in airtight container. Sharjala should be placed in cabinet for safe storage as well as sterilization. Leech application procedure is as below. Purva Karma, injection tetanus toxoid 0.5 ml intramuscular in left deltoid muscle. Kidney tray, gauze, cotton, gloves, mask are taken. 1 leech of medium size, approximately 40 gram to 50 gram in weight taken, and turmeric paste is applied to the leech and kept in a vessel of water for 45 minutes so that they get rid of exhaustion. Patient is made to sit or lie down. Pradhan Karma. The leech is made to stick at the site of wound. Leech is covered with a wet cloth except for its mouth. When pricking pain or itching is produced at the site of application, the leech is withdrawn from the region. Pachat Karma. The body of the leech is massaged with rice powder and mouth with the oil and salt so that it omits the blood completely, and after complete emptying, it is left in the vessel of water. Observation for the present case study. First day observation. On the first day, appearance of the ulcer having maximum proportion of unhealthy tissue, having tenderness with a slight malodor. The ulcer cleaning with Sharjala along with leech application and oral medicine, diosmin 500 mg BD, and advice electrocrep bandage, elevation of leg. There were no systemic sign of infection. Third day observation. On the third day, reassessment of ulcer with special reference to the mentioned assessment criteria for the present study. After removal of previous dressing which was not adherent to the ulcer and not stained with necrotic tissue. The level of exudate and necrotic tissue was medium. Sharjala dressing comfortably and not complaining of any local irritation. However, there was still evidence of same necrotic tissue. 7-day observation. Ulcer bed having minimum amount of slump but no malodor. Local sign of inflammation was reduced. The ulcer shows maximum evidence of newly healthy granulation tissue, which shows sign of healthy but edges and margins of ulcer still had chronic unhealthy tissues. Tenderness and pain to surrounding area was nearly come to the end. The sign and symptoms of varicosity were reduced to compared to previous week. Observation of 15th day. On the 15th day, ulcer bed is maximum filled with a newly formed red color and velvety appearance of granulation tissue. Edges and margin shows a little amount of healthy tissues. Patient shows very good quality movements of affected part. The patient was not complaining of any severe irritation or discomfort and was tolerating trial treatment comfortably. Observation on 21 day. On 21 day, the previous was nearly dry with less strain. Ulcer bed is maximum filled with healthy granulation tissue and shows contraction of edges and margin, and wound size was 3 cm into 4 cm. The sign and symptom of varicosity was reduced satisfactorily, but up to the 50% as compared to before treatment. Observation on 21st day. On 21st day, ulcer shows evidence of sign of healing and toxicity and circulation of the vein, shows progress on clinical examination, pain and cramp in affected leg also reduced. At the end of 1 month, the lipodermatosclerosis, eczema, abrasion were also shows improvement clinically. Patient was not complaining any discomfort and was tolerating trial group treatment for the condition. The ulcer size was reduced up to the 2.3 centimeter into 3.4 centimeter. Discussion. According to Sushil Saita, venous ulcer is a Dirghakalanobandhi Dushtravan. As per evidence-based medicine for varicosity and venous ulcer, oral medicine diazmin improve venous return supply and venous stasis, which ultimately shows improvement in sign of ischemia. Leech application once in a week shows improvement in microcirculation, which enhances new formation of healthy granulation tissue because of hirudin enzymes which emits by the leech saliva. In treatment of Dushtravan, Shara is most effective and powerful and having a power of Shodhan, Lekhan, Dharan properties. Shar Jala also act as a promegna, useful to remove slough, devitalize tissue and pus pockets. In the present study, Shar Jala shows significant clinical efficacy as add-on effect with oral medicine diazmin with leech application for venous ulcer as a successful therapy. Conclusion. So it can be concluded that combination of oral medicine diazmin, jala kaucharan and regular cleaning and dressing with shar jala possess sufficient efficacy to heal venous ulcer without producing any adverse effect in the new formation of integrated medicine. In today's surgical practice, idea of this formulation is a single candle of light which will help to give light from candle to candle, and coming day there will be brightness as a like the sunlight in the form of large scale population and multi-center for research work in the venous ulcer. Now some photographs of venous ulcers and leech applications, Sharjala application, wound dressing. These are the reference. Thank you.
Thank you, Dr. Amrita.
Okay, sir.
Next, I would like to invite Dr. Sheetal Vasantrao Vorkar for the paper presentation on the topic role of Panchakarma in Palaroga under the Kaumaran panel. Dr. Sheetal, are you there?
Yes, sir. Good evening, sir.
Good evening, doctor. Please start the session, doctor.
Okay. Sir, is my screen is
Yes,
visible?
screen is visible, doctor. But
okay, sir. Sir, my screen is visible?
your screen is visible, doctor, but we can't read anyone. Only white sheet is visible.
Okay, sir. Sir, give me a 1 minute. Sir.
Okay, doctor.
Sir, now? Hello,
Screen
sir.
is visible, doctor, but only white background is visible. Not anyone is clear.
8 months, sir. Sir, now? Hello?
No, doctor, not clear, doctor.
Sir, I am facing some issue to share my screen.
1 minute, doctor. I will share for you, doctor.
Okay, sir.
Doctor, please start the session, doctor.
1 minute, sir. Okay, sir. Good evening, all. I am audible, sir?
Yes,
Hello.
doctor, audible.
Good evening, all. Myself, Sheetal Vasantrao Borkar. I am from college, SMBT Ayurvedic College and Hospital, Igatpuri. My guide name is Vijay Suryavanshi. My title is, sir, next. My title is Role of Panchakarma in Balroga. Sir, next slide. Now abstract. Ayurveda is the science of life which deals with preservation of health and cure of disease. Good health is the best achieved when the regimens told in Ayurveda are promptly followed. In this science, treatment is the branch into two things, namely Shodhana Chikitsa and Shaman Chikitsa. Shamana Chikitsa included Dipana Pachana, and Shodhana therapy is best for uprooting the disease from the root itself. This principle also holds good for a child and irrespective of the age, as a basic constitution of the body, are the same in all age groups, as explained by Charaka. Though the matra of the same and medicine are varies. Routinely raised questions of benefits and contraindication of panchakarma are needed to be answered. Dosha prakopa occurs in child and adult body due to same causative factor along with extra risk in the baby due to mother breast milk vitation and immaturity, etc. Introduction. Sudhana Chikitsa included Panchakarma, which is the ultimate mind-body healing experience for detoxifying the body and strengthening the immune system, restoring balance and well-being. It is one of the most effective healing modalities in Ayurvedic treatment. It promotes detoxification and rejuvenation. At time, Acharya Kashyapa advised to avoid excess Sodhana procedure in a child, while Chakrapani suggests to administer the same in Swatantra Bala and to avoid the Partantra Bala. Panchakarma is a mainstay of the treatment in the Ayurveda. It has to be employed in all age group if the condition demands. Rather than the age when we adopt Panchakarma in children, Bala, Kala, Desha, Agni, tolerance capacity, etc. should be checked before employing the treatment in any age group. Hence, classics, especially the Kashyap Sahitas, explain the Panchakarma in a child with a detailed explanation of Snehana, Svedana, Vamana, and Virechana, with detailed explanation of the Basti and Nashta. Basti is considered as a nectar of the for the child. Now, procedure of Panchakarma are there is a 5 content. First is Vamana, second Virechana, third Basti, fourth Nastya, and fifth Raktamoksha. To prior the Panchakarma, Purvakarma preparatory measures like Dipana and Pachana, Snehana and Svedana are the give to the patient. After the Panchakarma, Sansarjan come list is advocated as a prospective measure. In classical references, it has been found that Panchakarma are indicated in children, although age group is not specific, but same was explained by Acharya Kashyapa, that it can be administered in moderate or the minimum level by contraindicating excesses, apatarpana and the bloodletting and Shodhana treatment. Before Panchakarma's treatment, using more snigdha, shita and vidyi substances. Anna, asana, lepa and parishishna, etc. are the explained. But Acharya Kashyapa, who is a specialist of Komarbritya, clearly says that both mother and the child should be administered with Shodhana. This clears that contradictory opinions about pediatric Panchakarma. Now Purvakarma, Dipana and Pachana. Before starting Panchakarma procedure, Dipana and Pachana should be done for obtaining Nirama Avastha of doshas. Hot water boiled with piece of dry ginger or dry coriander can be used in pediatric patients. It relieves ama, toxic accumulation. At the level of coastal abdomen and coastal shodhi occurs. Snehana, oleation. Snehana is the process of oleation of the body by using medicated oil and ghee internally and externally. It is an important preparatory procedure of Panchakarma. Chatusneha told by Kashyapa, 4 types, namely Grita means ghee, Tela means oil, Vasa means fat, and Majja means bone marrow. Out of these, Grita is considered as the best for Snehana. Now, Vaman Karma. Vamana is a bio-cleansing procedure used for the elimination of dosage, mainly kapha, accumulated in the upper gastrointestinal tract. Acharya Kashyapa mentioned that babies who emit whited milk from the stomach repeatedly will never suffer from disease. Acharya Kashyapa explains Vamana as the mainstay of treatment in Bala Rogas due to dominance of kapha dosha by including in kapha Kapavardhaka ahara like Kshira, Grita, etc. The Vamana has been done to clear the stomach from liquid, the meconium-like substances. Vamana Dravya and doses. As per Kashyapa, Vaman drug give in quantity which equal to Vidanga Phala, fruit of Pembelica ripes, and 2 to 3 seeds of Apamarga with honey and sugar. 2 or 3 Phala Vriddha Kasha. Other milk 750 ml Yasti Madhupat and 750 ml Lavanodaka. Indication: gastric problem, ajirna, kasha, swasa, madhumeha, unmada, kushta. Contraindication: acute peptic ulcer, atikshira, pipasa, shuddharika. Complications of Vamana: dryness of throat, Vataroka. Now Virechana, therapeutic purgation. It is the process where whited doshas, mainly pitta, are eliminated from lower gastrointestinal tract through the anal route. Therapeutic purgation administered very cautiously in pediatric patients because their chance of severe complication like dehydration. Material and equipment. Attached toilet is a must, towel, bedsheet, etc. Virechana dravya. Iranda tela means castor oil. Sankhini tela means euphorbia oil. Indication: constipation, creamy, Kamla, chronic fever, allergic dermatitis. Contraindication: Krish, Krush and Rajyakshma Garvin. Now Basti. Basti means medicated enema. It is the procedure where the medicines in suspension from form are administered through genitourinary tract using Basti yantra, specific apparatus. Among all the therapeutic procedure, Basti is superior because it is the Amruta, means nectar, in child patient and the most appropriate remedial measures for a Vata dosha. Basti is the Basti is the best indicated for the child and told that it is impart arogya to the child. Offspring for parents and name and the fame for the doctor and considered as a nectar for the child. Equipment: Basti Puttaka polythene bag having 1 liter capacity. Basti Netra nozzles means lavatory facilities. Other facilities are thread, vessels, turner, heating apparatus, table, bench, towel, hot water for a bath, etc. Ingredients: for medicated oil for Basti, Vatha, and Kalka, made from prescribed medicine, Madhu, and Sendhava. Types of Basti classified in many ways. Astapana, that means Kashaya, and that's mean Niruha. Second is Anuvasana, Sneha Basti, that's mean Matra Basti also. Third is Uttar Basti. If above bastis are given by genitive root, then called Uttar Basti. Indication: Vatroga, Rajonash, Niramatisar, cerebral palsy, delayed milestone, Amvata, Ashmari. Contraindications are Krisha, Chardi, Madhumeha, Kristara, and Shunapai. Complications are JIT, symptoms like pain in abdomen, vomiting, local and anal injury. Next is nasya, means nasal inflation. It is the process of administration medicine through nostril. Nasya is indicated mainly in aggravated and accumulated doshas of head and neck. Medicine Panchanendriya Vardhana Tela, Dhanvantar Tela, Anu Tela, Sadbindu Tela, Shunthi Churna for a Padamana Nashya. Types of Nashya. By Kashyapa mentioned two types of Nashya. Rihana, that's mean Purana Nashya. Kashna, Sodhana Nashya. Indications are Vyanga, Ardita, Vataroga, Urdha Jatrugat Roga, Shirshula. Next is Rakta Moksha. That means Jalokacharan, least therapy. This is the one of the types of Rakta Mokshan, blood cleansing and purification therapy, which is included in Panchakarma by Vagbhata. Jaloka means leech, commonly used for the purpose of Rakta Mokshana in child patient, old people, ladies, and those who are rich, fearful and suffocated. Indication: Gulma, Arsha, Kushta, Vatarakta, Visarpa, Virechika, Vicharchika, Netraroga, Shiroroga, Kantharoga, Vahiputan. Complications are leech migration, infection, and anemia. Conclusion are Panchakarma in pediatric has important role. All the 5 karmas are systematically explained in classic, which special interest of the child. It is disease status of the child, physical and mental strength of child, and extent of independency, which forms administration criteria for Panchakarma procedure in child rather than age. By explaining the above all Panchakarma procedure, one can understand that importance of Panchakarma procedure as well as consider this procedure in pediatric patients. So by adopting the certain role of consideration for Sodhana therapy, one can give a better health to a child. Now references. Then thank you. Thank you all.
Thank you, Doctor. Thank you, Dr. Sheetal. Next, I would like to invite Dr. Ashwini for the paper presentation on the topic Nidana Panchaga of Literacy. Dr. Ashwini, are you there? Hello, Dr. Ashwini. Next, I would like to invite Dr. Himanshi for the paper presentation on the topic Ayurveda management of post-thrombotic syndrome associated with chronic ulcer, a case report. Dr. Himanshi, are you there? Okay, next I would like to invite Dr. Rahul for the paper presentation on the topic Study the clinical efficiency of Aktikarma in the management of Avabahuga. Dr. Rahul, are you there?
Yes, hello.
Hello, doctor. Please start the session, doctor.
Okay. My screen is visible.
Yes, doctor. Screen is visible, doctor.
Okay. Welcome all of you. Here presented by Dr. Rahul Salalkar, Yamesh Shalyatandar, SV University's Ayurved College, Rauri, guided by Dr. Anand Kumar V. Shekukar, Professor and HOD of Department of Shalya Tantra, SV University Ayurved College, Rauri. My topic is study the clinical efficacy of Agni Karma in the management of Avbhavka, that is frozen shoulder. Introduction. The Ayurveda is an ancient science that deals with the treatment of various diseases, also with prevention of various diseases, and also about the improvement of lifestyle. That's why the Ayurveda is also called as science of life. Acharya Sushruta explained the Shalya Tantra in the Ashtanga Ayurveda as a main and important branch of because of Ashukriya Karnat, Yantra Shastra, Agni Pranidharnartharcha, Sarvatantra Samanyacha. As in Ayurveda, Avbhavka is disease in Vatavadi Adhyaya, in which the Vata is localized in the shoulder region, get aggravated and dries up the bindings, that is the ligament of shoulder joints, constrict the sira and causes the Avbhavka. On the basis of sign and symptoms, the Avbhavka, it can be correlated with the frozen shoulder. It is also called as humeroscapular periarthritis or adhesive capsulitis. Frozen shoulder is the disease with unknown etiology where the glenohumeral joint become painful and stiff because of loss of releasance of the joint capsule. In early stage, it shows the pain and stiffness of joint. Later on, the severe pain with the restricted movement of joint. The prevalence of frozen shoulder estimated about and 2 to 5% of general population. The frozen shoulder usually affects the patient with the age group of 40 to 70 years. For this disease, the NSAID mostly used for anti-inflammatory action, steroid injection, and physiotherapy are the line of treatment. All the treatment of modern science have many drawbacks or limitations. The long term of use of NSAID may suppress symptoms temporarily, but cause a gastric irritation and renal problem, and also other side effects. Since the prolonged use of NSAID is very harmful, so the alternative for NSAID is needed for the management of painful condition. Hence, the Agni Karma is Chikitsa is mainly used in disease related with the painful condition, advice in joint disorder. Disease treated with Agni Karma does not occur again, unlike the Shastra Karma and Shar Karma. And Agni Karma is performed by the special pointed metallic instrument called as Shalaka. It is heated and applied at the point of maximum pain and tenderness. In the frozen shoulder, it is applied at shoulder region. It will reduce the pain and joint stiffness. Agni Karma shows good result without any side effect. Hence, the Agni Karma can be used over the use of NSAID in long-term management of the Avbhavka, that is frozen shoulder. My case presentation is a 40-year-old female, which is housewife with the complaints of pain at shoulder joint and with the restricted movement of joint from the past 4 to 6 weeks. She has no any history of trauma or any other disease like DM or STM. She present requesting treatment for this pain. The pain has taken counter anti-inflammatory intermittently, which have providing some relief. On the physical examination, she had swelling and tenderness to the palpitation in the region and the restricted movement of joint. The remainder of her examination was unmarkable after she was diagnosed with the frozen shoulder. The patient was given Agni Karma on following manner, that is 11-1, 0 day, 7 day, and 14 day. After the first sitting and second sitting of Agni Karma, the patient got relieved from symptoms, and after the third sitting, she got completely relieved from the symptom. During the following period, it has also no any complication or any side effect. Discussion: the frozen shoulder Avbhavka is the produced by vitation of Vata dosha or without any anubandha of Kapha. So Agni Karma is considered to be the most preferred therapy or pacify the dosha by the line of action of Agni Karma. Agni Karma is having the Ushna Guna, which suppress the Vata and digest also the digest of Ama dosha. Conclusion: Agni Karma and its use is described by in Ayurveda much earlier than its utility was discovered by surgeon or rest of medicine branches. However, the technique equipment have been become advanced and sophisticated, but the basic principle are still same as that of Agni Karma, that is use of energy, heat, or current in the management of various diseases. Hence, this treatment modally can be prescribed as clinical procedure considering the effectiveness of safe therapeutic or alternative management in frozen shoulder, or also like many other painful conditions. The following are the references are used for this presentation. Thank you.
Thank you, Dr. Rahul. Next, I would like to invite Dr. Priya Ajay Bodale for the paper presentation on the topic Garbhini Paricharya according to Ayurveda. Dr. Priya, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Okay, sir. Hello.
Hello.
My screen is visible.
Not visible, doctor.
Now, sir.
Now screen is visible, doctor. Please start
Okay.
the session, doctor.
Okay. Myself is Dr. Priya Ajay Bodle, PG scholar of MS Prasuti Tantra and Stree Rog department. I am presenting Garbhini Paricharya under the guidance of Dr. Chetna Kulkarni and HOD Dr. Madhuri Balgad, Department of Stree Rog and Prasuti Tantra, SVNST Department, Ayur and Mahavidyalaya, Rauri Factory, Ahmednagar, Maharashtra. Abstract. Pregnancy is the most important and clinical part of the every woman's life. So systematic examination, dietary and other advice are very important. This systematic supervision is called as a Garbhini Paricharya. In modern, it is called as antenatal care. Ayurveda consider food to be the best source of the nourishment as well as the medication for the pregnant woman. The 9-monthly diet is the significantly unique to the Ayurveda. It changes in the accordance with the growth of the fetus in the womb and the same time ensures the health of the mother. The things which are contraindicated in the pregnancy is known as Garbhodgat Bhav, and the avoidance of these things is necessary for the well-being of the fetus. In this paper, we have described monthly dietary regimen. Keywords: Garbhini Paricharya, antenatal care, Ayurveda, Charak Samhita, Sushrut Samhita, and Harit Samhita. Now, introduction. In India, women of a childbearing age constitute 22.2% and children under 15 years age 35.3% of the total population. Together, they constitute nearly 57.5% of the total population. Mother and child must be considered as a one unit. It is because during antenatal periods, fetus is the part of the mother. The period of the development of the fetus is about 280 days. During this period, the fetus obtains all the building material and oxygen from the mother's blood. Purush or Garbha is born and grown up from Ahar Ras. So Ahar Ras should be maintained healthy. The food and behavior should be such that the Ahar Ras is protected at all cost. As the Garbha is a small from a Purush, the birth and the growth of the child depends upon the food and action of the mother. The food taken by the pregnant woman nourishes and helps the growth of the fetus, nourishes the mother's own body, nourishes the breast by which the breast milk forms and maintains the newborn baby. Child health is closely related with the maternal health, and healthy mother brings forth of the healthy baby. There is a less chance for a pregnant premature birth, stillbirth, abortion. Most important phases of a life of mother and child is the antenatal period. It is known as a Garbhini Paricharya in Ayurveda. Objective: to study the Garbhini Paricharya in details literary study on the Garbhini Paricharya. Materials and methods. This Garbhini Paricharya can be studied into 3 parts. That is Masanumasik Patya, monthly dietary regimen, Garbhodgat Bhav, activities and substances which is harmful for the fetus. आणि गर्भस्थापक द्रव्य, substances beneficial for the maintenance of the pregnancy. नंतर मासानुमासिक पथ्य, month wise dietary regimen. During pregnancy, fetus starts to grow to get nourishment from the mother through placenta. Adequate nutrition is needed for a monthly constant and proper growth of embryo. In Ayurvedic Samhita, the month-wise dietary regimen is given in details, is known as Masanumasic Paricharya. For a woman right from the first month up to the 9th month of the pregnancy. The monthly regimen is necessary to make pelvis, waist, sides, and chest, back healthy and flexible and downward movement of the vata. This is needed for the normal delivery. Here we show the chart for the Charak Samhita, Sushrut Samhita, Ashtang Samhita, and Harit Samhita of the Masanumasic Paricharya. Firstly, I introduce the Charak Samhita. Charak told that Prathame Masi Shira Manu Sanskrutam, matlab Shir without any Sanskrit, with any drugs. Dvitiya Mase Shira Mevacha Madura Ushada Siddham. तृतीय मासे क्षीर मधु सर्पी व्यव अनुपसंस्कृत जन्य. चतुर्थे मासे क्षीर नवनीत अक्षमात्रम. पंचमे मासे क्षीर सर्पी. षष्ठमे मासे क्षीर सर्पी मधुर औषध सिद्धम. तदवे सप्तमे मासे सेम एज अ 6th month. अष्टमे तु मासे क्षीर यवागु सर्पी श्मति. नवमे मासी क्षीर यवागु सर्पी श्मति. मधुर औषध सिद्धेन तैलानुवसेत Tailanuaseta Pichuyono. Now, and Sushrut told that Pratham Aditiya Tritiya Maseshu Madhu Shita Dravya Praya Ahara Manu Sevate. Tritiya Shashtikodama Paisa, Chaturte Payo Navnita. Panchame Jankal Mansa Sahita Mannam, Shashtesh Shwadramshta Siddhama Sarpi. Saptame Sarpi, Pritakuparani Siddhama. Ashtame Badasakena Balashata Pushpa Mastu Tela Lavana Stapayata. Mande Astapan Basti. And now may Purana Purusha Siddham Anuvasatena Telanu Aseta. Then Garbhodghatar Bhav. Tikshna Ruksha Ushna Dravya should give one. Hello.
Yes, screen share is not visible, doctor. Once again, please share, doctor.
Now it
not
is
visible, doctor.
Okay. Okay, now it is visible.
Yes, doctor, visible, doctor.
Okay. Garbhodghatar Tikshna Ruksha Ushna Dravya should given up false smelling articles, should not eat dried up, stale, putrefied or wet food. Nanta Vistambi Vidahi food, as these are harmful for the fetus. She should avoid heavy exercise, coitus, harsh and violent activities, ride over vehicles, excess satiation, excess emaciation, sleeping in a day, awaking in a night, sitting in uneven places. Should avoid fasting, grief, anger, visiting lonely places, cremation ground, prolonged stay near fire or hot sun. Her sleeping and sitting place should be covered with a soft cushion and mattresses. Garbhastapak dravyas, substances beneficial for the maintenance of the garbha. Garbhastapak dravya counteract on the effect of the Garbhodghatar bhav and help in the proper maintenance of the garbha. They can also use as a treatment and prevention of abortion. Some of the Garbhodghatar bhav are Endri, Brahmi, Shatavirya, Sahasravirya, Amoga, Avyatha, Shiva, Arishta, Vatyapushpi, and Vishwasekanta. This drug is a juvenile gun and can also be used as a similar way. Discussion. We have discussed various diet and various do's and don'ts in the pregnancy. Similar in the modern medication, also describe antenatal care by describing antenatal diet, that is extra calorie diet is required. Diet to prevent anemia, that is Garbhini Pandu, and personal hygiene, rest and sleep, exercise, light work. And describe. Conclusion. The ancient Ayurveda literature described in various Samhita is not only unique but also scientific with modern science. So antenatal care should be done as per Ayurveda. Here, references I use for this paper presentation. Thank you.
Thank you, Dr. Priya.
Yes.
Next, I would like to invite Dr. Gautami M. Phatke for the paper presentation on the topic role of Langhana Chikitsa with respect to Thaulya. Dr. Gautami, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Yes. Is it visible?
Not visible, doctor. And can you increase your voice? Your voice is very low, doctor.
Sir, is it visible?
Yes, doctor. Now it's visible, doctor.
Okay. Good evening, everyone. My name is Dr. Gautami Phadke, and today my topic is role of Langhana with respect to Thaulya, guided by Dr. Amit Avarkar. Introduction. India is in the 7th place in the term of obesity index. Being obese or overweight brings significant risk at the range of different points throughout the life. Charak has mentioned Staulya under the section of Santarpanatha Vikar, also mentioned in Ashtam Ninditiya Adhyay. Acharya Sushruta has added the complications of the diseases and given preventive measures to avoid causative factors also. Ayurvedic Sahitas formulate the cause-effect relation regarding obesity and its treatment. Aim is to study the role of Langhana Chikitsa as a treatment of Staulya. Ayurvedic perspective of diseases is mainly about prevention, maintaining healthy status of healthy individual and treating the illness of a diseased one are the main fundamental principle mentioned in Ayurvedic texts. For applicability of the principle, Shadvidopakram mentioned by Acharya Charak in Charak Samhita and Ashtanga Hridayam by Acharya Vagbhata mentioned all these under Dvidhopakrama Chikitsa. Problems like metabolic diseases, thyroid, hypertension, diabetes mellitus, obesity, uh, dyslipidemia, rheumatoid arthritis are the diseases caused mainly by an unhealthy lifestyle. Due to various Aharaj and Viharaj hetu, arm is generated, which is the root cause of all diseases according to Ayurveda. In this paper, a conceptual study was carried out to mention the efficacy of Langhan Chikitsa in the treatment and prevention of obesity. Material and method. For this study, various Ayurvedic Samhitas, modern textbooks, published articles, and information from internet are used. संप्राप्ति of स्थौल्य मेधसा आवृत्त मार्गद्वार वायुकोष्ठे विशेषतः चरम संदुष्यति अग्निम आहारम शोषयत्यग्नि. Medo dhatu obstructs the scrotus related to posture and this results in obstruction of vata dosh in digestive system. Lakshana of obesity. According to the modern sciences, BMI more than 30 is the diagnostic tool for obesity. Charak has enlisted the following symptoms as a cardinal symptoms for obesity. Medo Masa Ativriti, Ayushor Heart, pendulous buttocks, abdomen and breast, um, upachaya, yathopachaya, less energy levels, more sweating, daurbalya, daurgandhya, atipipasa, निरुक्ति of Langhan Chikitsa. Nirukti of Langhana, Yat Kinchita Laghavakaram Dehe Tat Langhanam Smritam. According to Acharya Charan, Langhana has 10 types. There are two main subtypes, Shodhanadi 4 types and Shamanadi 6 types. The complete Langhan Chikitsa can be implemented as Shodhan Rupi and Shaman Rupi Langhan, depending upon the degree of altered metabolic responses in the body, Prakriti, Avastha, Agni Rogamarga, and different types of Langhana are suggested by physicians. Shodhanadi Langhan Chikitsa. In Bahudosh Avastha, There we have Shleshma and Pitta Samaklesh, where it is indicated. Santarpunotha Vyadhis are mostly associated with Kapha Pitta Dosha, where Shodhanadi Langhan Chikitsa is expected. And the four subtypes are Niruhavasti, Vaman, Virechan, and Shirovirechan. Shamanadi Langhan Chikitsa, where Pachan is the one of the Langhan type, is essential for Madhyam Dosha Avastha. Uh, it is also associated with Kapha Pitta Dosha. Pachan has been indicated in the following Madhyabala Rogas like Rudro, Visuchika Alasa, Jwara, Vibandha Gaurav, Udgar, Rulla, Arocha, etc. Diseases caused by vitiation of Kapha and Pitta Dosha. In Alpa Dosha Avastha, Kshudha, Pipasa, Vyayam, Atap Sevan, and Maruta Sevan are relatively mild forms of Langhan Chikitsa and are stated in Alpa Dosha Avastha as well as in the Durbal Rukhna. Pipasa is holding the urge to drink water. Atap Sevan does shaman of Nili Kapha Dosha and brings lightness to the body. Maruta Sevan, certain winds with specific direction are told to be healthy. Vyayam, a physical action which is desirable and is capable of bringing about bodily stability and strength. Upavasa. In our Samhitas, we find the indication of Upavasa in the terms of Langhan Chikitsa in many Vyadhis such as Jwara, Atisar, etc. Discussion. Obesity does gradual changes in our body. Nidana such as Ati Bhojan, Ajirna, Vishamashran, Asatmya Bhojan, Ahar with Guru Shita, Atisnigdha, Dushta Bhojan, Vega Vidharan, Rutu Vaishamya, etc., which in turn causes Agni Mandya and Ama Utpatti. When the function of Agni is vitiated, there is improper nourishment of Rasa Dhatu and successive dhatus like Rakta, Mamsa, Meda, respectively. Finally leads to Sharir Apachaya, that is improper nourishment of the body, and Ochakshaya, resulting in complication of Sthavya. Accumulated Amadosh is one of the important responsible factors for Sthavya, and to eliminate Ama, Langhan Chikitsa is having very effective results to prevent obesity as well as to cure it. According to Acharya Vakvat, Murda Dosh, Amadosh, Snehadikya, Jwara, Urustamba, Kushta, Visarpa, Vidrati, Liha Rog, Shiro Rog, Kantha, and Netra Rog are few indications where Langhan is the most probable given treatment. It was observed that Guru Shita Abhishanti Snigdha Ahar is the responsible factor for obesity and all the hetus which causes Agni-mandya and Dhatu Agni-mandya. In Agra Sangra mentioned in Charak Samhita, following other references were wrong dietary habits. Ati Matrashanam Amadosha Pradosha Ama Pradosha Hetunam Guru Bhojanam Durvipaka Karanam Ajirna Adhyashanam Grahani Dushananam. Wrong dietary habits like Vishamashan, Anashan, Samashan, and Adhyashan were observed to be followed by majority of the patients, resulting in obesity. It has also been quoted that the state of mind, body and mind, as well as the disease originates from and depends upon quality and quantity of ahar. Therefore, the first line of treatment for Vyadhis originated from Amadosh, Dushit Kapha Pitta, Dosha Avastha can be treated with Langhan Chikitsa. And these are my references for above paper. Thank you so much, sir.
Thank you, doctor. Next, I would like to invite Dr. Priyanka Arun. Dr. Priyanka, are you there? Okay, next I would like to invite Dr. Preeti Gupta for the paper presentation on the topic Ushavana. Dr. Preeti Gupta, are you there? Dr. Preeti, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Yes, sir. So is it visible?
Yes, doctor. Visible, doctor.
Can I start, sir?
Sure, doctor. Please start the session.
Okay, thank you, sir. Good evening to all of you. Myself, Dr. Preeti Gupta, MD Scholar in Ayurveda, PG Department of Dravya Gun Vigyan, under the guidance of Dr. Chandan Singh Ji, HOD and Professor of PG Department of Dravya Gun Vigyan in Dr. Sarvapalli Radhakrishnan, Rajasthan Ayurveda University, Karwar, Jodhpur. Today, I am representing the topic Ushapan. First of all, introduction. Ayurveda, the science of life, deals with every aspect of life, It gives priority to maintain the health of an individual and has a unique approach to cure the diseases. आयुर्वेद के प्रथम उद्देश्य की अगर हम बात करें तो वो भी यही बताया गया है, स्वस्थस्य स्वास्थ्य रक्षणम, अर्थात सर्वप्रथम स्वस्थ के स्वास्थ्य की रक्षा करना। इसके लिए आयुर्वेद में कई कॉन्सेप्ट दिए गए, लाइक सद्व्रत, दिनचर्या, ऋतुचर्या, आहार विधि विधान, रसायन सेवन आदि। दिनचर्या के अंतर्गत अगर हम बात करें तो सबसे प्रथम सोपान बताया गया ब्राह्मे मुहूर्ते उत्तिष्ठे, अर्थात सूर्य उदय से पूर्व जागना। ब्राह्मी मुहूर्त को हम जो कंसीडर करते हैं वो करते हैं रात्रि का 14वां मुहूर्त। एक मुहूर्त को हम लगभग 48 मिनट के लगभग मानते हैं। ये वो समय है जो हम उसको मॉडर्न के अकॉर्डिंग मान सकते हैं कि सूर्योदय से लगभग 1.5 घंटे के पहले का समय हम ब्राह्म मुहूर्त के अकॉर्डिंग लेके चलते हैं। ब्राह्मी मुहूर्त उत्तिष्ठे स्वस्थो रक्षार्थम आयुष्य है। ब्राह्म मुहूर्त सबसे आदर्श समय है उषापान का पालन करने के लिए। नाउ व्हाट इज उषापान? उषापान क्या है? आयुर्वेद के अंतर्गत उषापान को हेल्दी डेली रेजिमेंट का एक पार्ट बताया गया है, अर्थात जो स्वस्थ रहने के लिए प्राकृतिक दिनचर्या का विधान किया गया है, उसके अंतर्गत उषापान का वर्णन आया है। उषा अर्थात टाइम जस्ट बिफोर सनराइज, उषा अर्थात सूर्योदय से पूर्व का समय, और पान अर्थात ड्रिंक यानी कि पीना। तो उषापान का मतलब हुआ कि सुबह जल्दी उठ के अर्थात ब्रह्म मुहूर्त में जलपान करना, दैट इज उषापान। उषापान का वर्णन सबसे पहले आयुर्वेद में भाव प्रकाश में आया है, जो कि दिनचर्या विषय के अंतर्गत बताया गया है। दिस मीन्स दैट दिस इज अ हेल्दी हैबिट दैट कैन बी फॉलोड बाय ऑल हेल्दी इंडिविजुअल्स। जो स्वस्थ है उसे प्रतिदिन उषापान का पालन करना चाहिए। अगर हम भ्रत्रय की बात करें, चरक संहिता, सुश्रुत संहिता, अष्टांग हृदय, तो इन तीनों के अंतर्गत उषापान का वर्णन नहीं किया गया। Now, what is the quantity of water for उषापान? सवितुः समुदय काले प्रसूति है शैलस्य प्रभेद अष्टौ रोग राज परिमुक्तो जीवेद वत्सत शतम सअग्रम। आचार्य भाव मिश्र ने सर्वप्रथम भाव प्रकाश में उषापान का वर्णन किया, और वहां पे उषापान के लिए जल की जो मात्रा बताई वो लगभग 8% बताई, जिसे हम लगभग 640 ml के बराबर मान सकते हैं। और इसके साथ ही उन्होंने बताया कि अगर कोई मनुष्य प्रतिदिन उषापान के अंतर्गत 8% जल का पान करता है तो वो 100 वर्षों से भी अधिक जीवन प्राप्त करता है। उषापान के लिए जो आदर्श समय बताया गया वो रात्रि का 14वां प्रहर अर्थात मुहूर्त बताया गया है। आचार्य भोज के विचार से उन्होंने कहा कि परुषित जल का पान उषापान के अंतर्गत करना चाहिए, अर्थात रात भर रखा हुआ जो जल है उसका पान उषापान के अंतर्गत किया जाना चाहिए। अगर हम आचार्य सुश्रुत की बात करें तो उन्होंने भी एक सूत्र स्थान 46वें अध्याय के अंतर्गत ताम्र जल का सेवन बताया है। अब उषापान के लाभ क्या हैं? व्हाट आर द बेनिफिट्स ऑफ उषापान? अर्षय शोतय ग्रहणी, अर्थात जो मनुष्य प्रतिदिन उषापान का पालन करता है तो वो अर्श, शोथ, ग्रहणी, ज्वर, जठर रोग, जरा व्याधि, कुष्ठ व्याधि, मेदो विकार, मूत्राघात, पित्तज विकार, श्रवण रोग, गल रोग, शिरय रोग, श्रोणी शूल, अक्षी रोग, इन सभी से मुक्त रहता है। साथ ही उषापान के पालन से वातज, पित्तज, शतज और कफज व्याधि से भी मुक्ति मिलती है। इसके साथ साथ उषापान के कुछ अदर बेनिफिट्स भी हैं, लाइक drinking water as soon as you wake up before sunrise can help to flush the toxins out of your body easily. रात भर में जो टॉक्सिन्स हमारी बॉडी में इकट्ठे हुए हैं, मॉर्निंग में उनको फ्लश आउट करने के लिए उषापान सहयोगी है। It helps to improve body metabolism. बॉडी के मेटाबॉलिज्म को प्रॉपर करने के लिए भी उषापान लाभदायक है। In those suffering from constipation, it can induce bowel peristalsis and thus relieve constipation. अगर किसी को कॉन्स्टिपेशन का प्रॉब्लम है देन उसे उषापान का सेवन करना चाहिए। Drinking water in the morning reduces calorie intake during breakfast, thus helping in weight management. मॉर्निंग में उषापान करने के बाद उसके लगभग 1 घंटे बाद अगर हम ब्रेकफास्ट कर रहे हैं तो वो अग्नि को बैलेंस करेगा और इससे वेट मैनेजमेंट भी प्रॉपर होगा, अर्थात ओबेसिटी को वो क्योर करेगा। It is also beneficial to keep the body well hydrated. It has positive effects on the brain and can reduce mood fluctuations and fatigue. उषापान का पालन करने से जो हमारी बॉडी है वो वेल हाइड्रेटेड रहती है, हमारे ब्रेन पे पॉजिटिव इफेक्ट होता है, और जो दिन भर की थकान जैसा हम फील करते हैं तो उससे भी राहत मिलती है। Ushapan also has positive benefits on the immunity and skin health of an individuals. उषापान का पालन करने से क्योंकि बॉडी मेटाबॉलिज्म प्रॉपर हो रहा है, बॉडी हाइड्रेटेड हो रही है, तो वो इम्यूनिटी को भी स्ट्रांग बना रहा है। आचार्य भावमिश्र ने उषापान का वर्णन करने के बाद नासा जलपान का भी वर्णन किया है। नासा अर्थात नोज, जल मतलब वाटर, यानी कि नासा के द्वारा जो जलपान किया जा रहा है दैट इज नासा जलपान। A person who wakes up early in the morning as soon as the darkness of the night wanes and drinks water through the nostrils will be very intelligent with sharp eyesight like an eagle. He does not suffer from wrinkling of the skin and graying of hairs. He remains free from all kinds of diseases. अर्थात अगर कोई व्यक्ति अपनी प्रतिदिन दिनचर्या में नासा जलपान करता है तो वो बहुत ही इंटेलिजेंट होगा और उसका जो आईसाइट है वो जस्ट लाइक अ ईगल होगा। कहने का तात्पर्य ये है कि नासा जलपान का दृष्टि पे बहुत ही अच्छा इफेक्ट है। नाउ व्हाट इज द क्वांटिटी ऑफ वाटर फॉर नासा जलपान? पातव्यम नासया नीरम प्रसृति त्रय मात्रया। आचार्य भावमिश्र ने नासा जलपान के लिए जो जल की मात्रा बताई वो बताई 3 प्रसृत अर्थात लगभग 240 ml। नाउ व्हाट आर द बेनिफिट्स ऑफ नासा जलपान? अगर हम नासा जलपान की बात करें तो प्रतिदिन नासा जलपान करने से व्यंग, बलि, पलित, पीनस रोग, वैश्वर्य रोग, काश, शोथ, रजनीशय, इन सभी में नासा जलपान का योगदान है, इन सभी से मुक्ति दिलाता है। इसके साथ साथ नासा जलपान रसायन का भी कार्य करता है और सबसे अधिक आईसाइट को इंप्रूव करता है, दृष्टि ससंजनम। नाउ देयर आर सम कॉन्ट्राइंडिकेशंस फॉर नासा जलपान। स्नेहे पीते शते शुद्धाव आत्माने स्मित उदरे हिक्कायाम कफ वातोते व्यादो तद्वारी वार्ये। अर्थात नासा जलपान प्रतिदिन स्वस्थ रहने के लिए बहुत आवश्यक भी है और सही भी है, परंतु अगर किसी व्यक्ति ने स्नेहपान किया है, अगर वो शत से पीड़ित है, पंचकर्म के द्वारा उसका शोधन हो रखा है, अगर उसको आत्मान की समस्या है, इंटेस्टाइनल मोबिलिटी एब्सेंट है, हिक्का रोग है, कफस व्याधि से पीड़ित है, वातज व्याधि से पीड़ित है, तो उसके लिए नासा जलपान का कॉन्ट्राइंडिकेशन बताया है अर्थात निषेध बताया है। फाइनली कंक्लूजन, both Ushapan and Nasa Jalpan are simple procedures with many benefits. These procedures should be practiced on a daily basis during the Brahmi Muhurat before any other activities. Include this procedure in your daily routine to enjoy its benefits and to lead a long and healthy life. अर्थात स्वस्थ रहने के लिए उषापान और नासा जलपान दोनों को डेली रेजिमेन में इंक्लूड करना आवश्यक है। थैंक यू।
Thank you, Doctor.
Thank you, sir.
Next, I would like to invite Dr. Sneha Devidas Vakte for the paper presentation on the topic Saptapadartha of Dravya Guna and their clinical importance. Dr. Sneha, are you there?
Yes, sir.
Doctor, please share the screen, Doctor.
Yes, sir.
Your screen is visible, Doctor. Please start the session.
Okay. Good evening, all. My name is Dr. Sneha Devidas Vakde from LRP Ayurvedic Medical College Hospital, Islampur district, Sangli. I am MD final year student, and my topic name is Saptapadartha of Dravya Gun and their clinical importance. Abstract. Dravya Gun deals with attributes, actions, and uses of medicinally useful herbs and some products of animal origin. Dravya is an essential and inevitable factor to human life. The similarities of Dravya and human body from its molecular level made it an part of Ayurveda. Dravyaguna is an integral part of Ayurveda which deals comprehensively about Saptapadartha, Rasaguna, Virya, Vipak and Prabhav of herbs, and also deals with identification, collection, storage and preservation of raw material plant origin. Abstract. Five fundamental principles Rasaguna, Virya, Vipak and Prabhav, collectively known as Rasapancha, explains pharmacodynamics in Ayurveda. Dravyagun helps in the knowledge and identification of a number of medicinal plants from which the active principles are extracted. The action of these drugs depend upon their Rasapanchak. The paper is attempt to explain the importance of Saptapadartha and one can understand the action of various drugs properly. Introduction. Dravyaguna deals with study of medicinal herbs and drugs, their origin, nature, properties and effects upon human beings. Its complete science of herbal plants. It finds its parallel in the modern science of pharmacology. It is the time when Ayurvedic concept should be proved on modern parameters. Ayurvedic pharmacology is being deal with these terms: Dravya, Rasa, Guna, Virya, Vipak, Karma, and Prabhav. Dravya. Dravya means drug in this context. It is the substratum of properties and action. Drug was studied extensively and intensively in ancient times. Charak has classified drugs from various angles. Example, according to source, effect on dosh, composition, properties, action, etc. Marvelous piece in the Charak Samhita is the description of 50 groups of drugs according to their main action. Similar classification is found in the Sushruta Samhita, where 37 groups of drugs are defined according to their effect and therapeutic uses. In this connection, two broad propositions are established. First, there is no substance which cannot be used as a drug. Second, all drugs are composed of five bhutas. Gunas, that is property. Guna is defined as that which is inherently existent in substance and is not inherent causes. Guna are 41 in number, are classified into four groups: somatic, psychic, physical, and applicative. First, there are further elaborated as follows. Somatic, that is Gurvadi Gun, are 20 in number, which can be arranged in pair, one opposite to the other, such as first Guru Laghu, Shita Ushna, Snigdha Ruksha, Manda Tikshna, Shlakshna Khara, Sandra Drava, Mridut Kathin, Sthira Sara, Sukshma Sthula, Vishada Pichila. Psychic qualities, that is Adhyatmic Guna. These are 6 in number, such as Ichha, Dvesh, Sukha, Dukha, Prayatna, and Buddhi. Physical or material qualities, that is Vishishta Guna, Shabda, Sparsha, Rupa, Rasa, Gandha. Applicatory are Paradi Gunas are 10, such as Paratva, Aparatva, Yukti, Sankhya, Samayog, Vibhaga, Pruthikatva, Parimana, Sanskara, and Abhyasa. Rasa. Etymology of rasa. Rasa or taste is something experienced by an individual while consuming a dravya. Definition of rasa. Rasa is the special sense known through the rasna or rasendriya. Modern physiology defines taste as the direct action of drug, the nerve ending in the mucous membrane of the mouth. Rasa are 6 in number. Rasa. First is Madhur. Panchabhoti composition is Prithvi and Jal. Action. It will coat entire oral cavity with its sweet taste, pleasure, and strain to body organs. Will be seen. It is more attractive by ant, flies, etc. Effect on dosh: Vata, Pitta, Shamak, and Kapha Vardhak. Indication: Vat, Roga, Murcha, Rakta, Pitta, Asti, Bhagnam. Second ras is Amla. Panchabhoti composition Prithvi and Tej. Actions: it washes or clears the oral cavity. It results in tingling sensation of teeth, blinking of eyes due to its sour taste. Effect of dosh: Pitta, Kapha, Vardhak. Indication: Hridrog, Agni, Mandya, and Vat Rogas. Third ras is Lavan. Panchabhoti composition Jal and Agni. Action: it spreads all over the oral cavity and causes dryness due to osmosis. It also results in burning sensation in the buccal cavity and throat. Effect of dosh: Vata, Shamak, Pitta, Kapha, Vardhak, and Pitta Vardhak. Indication: वात रोग, अग्निमांद्य, मधुमेह. Third rus is Katu, Panchabhoti composition, Vayu and Agni actions. It stimulates the tip of the tongue, causes burning sensation over the tongue and oral cavity, result in watering from eyes, mouth and nose. Effect of dosh, Kapha Shamak, Vata Pitta Vardhak, indication Kandu, Grahani, Agni Mandya. Fifth rus is Tikta, Panchabhuti composition, Vayu and Akash. Action, it catches the entire oral cavity and reduces the desire to eat, causes burning in the throat. Effect of doshas, Pitta, Kapha Shamak and Vata Vardhaka. Indication, Amla Pitta, Am, Vat, Kushta, Krumi Rog, Medo Rog. Sixth rus is Kashai, Panchabhoti composition, Vayu and Prithvi. Action, it produces a feeling of stiffness of tongue, dry and stiffness in the throat and strotus of body. It results in catching pain in the heart. Effect of dosh, Pitta, Kapha, Shamak and Vatavardhak. Indication, Atisar, Grahani, Tvak Vikar and Medorog. Vipak. Etymology of Vipak, the end product of the dravya, which is the outcome of the digestion metabolism, is known as Vipak. It is believed that Vipak is the biotransformation phase of Ras. Definition of Vipak, it is the final transformative state of Ras of given dravya. Rasa. There are three types of Vipak. Ras, Madhur and Lavan Ras. Vipak is Madhur Vipak. Dosha Karma, Kaphavardhak. Example, Gruta, Kshira, Ikshu, Draksha and Sendhav. Rasa, Amla Rasa. Vipak is Amla Vipak. Dosha Karma, Pitta Vardhak. Examples, Amlika and Changeri. Rasa, Katu Tikta, Kashaya Rasa. Vipak is Katu Vipak. Dosha Karma, Vata Vardhak. Examples, Hingu, Mari, Chitrak. Virya. Virya is a Shakti, which is means of action. Virya term is derived from the Sanskrit root vir, meaning that which, powerful or potent. Virya is the factor which is capable of or which responsible producing drug action. Types of virya. According to Paribhashika Viryavad, there are two types of Viryavad. Ashtavidha Viryavad. Sushrut opens that out of 8 prominent gunas, Guru, Lagu, Shita, Ushna, Snigdha, Ruksha, Mrudu, Tikshna, the one of which is the most powerful is called as Virya. Hence, he has named these 8 gunas as Virya. This is named Ashtavidha Viryavad. Dvividha Viryavad. This study suggests that there are two Viryas, that is Shita and Ushna. Shita Virya. Prithvi plus Jal Rasa Madhur Tikta Kashai. Grahatva can be felt by the skin. Doshas aggravates cough, elevates pitta, dhatu, rakta prasadana, sapta dhatu vardhaka and oj vardhaka. Other actions, Agnimandya, Kledan, Prinan, Balya, Strotorodha, Dravya Dugdeka, Draksha and Ikshu. Ushnavirya, Vayu plus Agni, Rasa, Katu, Amla, Lavan. Grahatva can be understood by the touch sensation. Aggravates Pitta, elevates Vata, Kapha. Dhatus, Raktavardhak, Ojakshaykarak. Other action, Agni, Dipan, Glani, Trishna, Dravya, Marich, Jirak and Hingu. Guru Virya, Prithvi and Jala, Rasa, Madhura, Lavana, Kashai. Grahatva can be seen and felt by the skin. Aggravates kapha and elevates Vata Pitta. Vrishya and Vajikaran, Asti Puran, Sandhi Bandhan, Dravya Musadi. Laghu, Agni, Vayu, Akash, Rasa, Katu, Tikta, Amla, Grahatva, Chakshu and Sparsharendriya. Aggravates Vat, elevates Kaf, Dhatukshay, Lekhan, Rukshan, Ropan, and Dravya, Chitrak, Marich, Nimba. Snigdha, Jala, Rasa, Madhura, Grahatva, Chakshurendriya, aggravates Kapha, elevates Vata, nourishes Dhatu, Snehan, Santarpan, Vajikaran, Dravya, Taila, Vasa, Gruta. Virya, Ruksha, Vayu, Rasa, Katu, Tikta, Kasha, Grahatva, Chakshu, aggravates Vata, elevates Kapha, Dhatu, Dhatukshaya, constipation and Ropan, and Dravya, Chitra, Khadir, Nimba, Mrudu. Jal and Akash, रस मधुर, ग्राहत्व स्पर्श, ॲग्रेवेट्स कफ, एलिवेट्स वात पित्त, वृद्धी, रक्त मांस प्रसादन, सृष्ट मलमूत्रपट्टी, क्षीर अँड घृत. तीक्ष्ण अग्नी, रस कटू, ग्राहत्व कॅन बी फेल्ड बाय स्किन, ॲग्रेवेट्स पित्त, एलिवेट्स कफ, धातू क्षय, क्लेद दोष, क्लेद चूषण, भल्लातक अँड चित्र. प्रभाव. This specific power is based on the specific nature and exerts specific action. It is known from the specific nature initiated by specific combination, as said by the Vriddha Vagbhat, that prabhav is swabhav, existing all. This specific nature leads to specific action like emesis, purgation, etc. For instance, the specific natural composition comprising of the specific bhautik composition of the active fraction of danti causes specific action. That example, purgation, whereas chitrak devoid of it does not process that power. Some dividing power as of two types based on the explicable and unexplicable action say that the power behind explicable action is virya, while that causing inexplicable one is prabhav. This is not correct because in scripture power is said as of two types according to generality and specificity. General power is known as virya, while the specific one is prabhav. This has been stated by Charak clearly as follows: where there is similarity of ras, virya and vipak, but specific difference in action, it may be taken as caused by prabhav. Vagbhat also follows the same line. The specific action, in spite of similarity in ras, its etc., is caused by prabhav. In this definition, there is no mention of explicable or inexplicable. Wherever there is some case like that, it can be included in prabhav because of its specific action, as has been said by Charak in case of wearing of gems. Here the word achintya has been used in the context of wearing of gems and not as a part of the definition of prabhav. Karma. Karma is defined as that which is the cause of conjunction and disconjunction, characterized by movement and located in dravya. Karma is instrumental cause in conjunction and disconjunction. This cannot take place without karma. The word kriya lakshanam means that which is indicated by movement. As said by Charak, karma is movement initiated by conscious will. It may be elaborated further as follows: in living organs or tissue, response caused by conscious will, a quality of self in the form of movements, is karma. For instance, danti on ingestion stimulates movements in living intestines, resulting in purgative action in emesis, etc. Also, the similar phenomena are observed, like guna karma is also located in dravya. Charak defines karma as follows: karma is that which is the cause of conjunction and disconjunction, is located in dravya, does not require any other factor as its cause. Karma does not require any other karma for its operation, as it has been said in the Vaisheshik Sutra that karma is not caused by karma. In general, drug possessing madhura rasa will have madhur vipak and shita virya. Similarly, amla ras will have amla vipak, ushna virya, and katu ras will have katu vipak and ushna virya. Drug possessing lavan ras will have madhur vipak and ushna virya, but drugs containing tikta and kashay ras possessing kato vipak and shita virya. Naturally, when ras etc. are of in equal strength, ras is subdued by vipak, both by virya and all by prabhav. In case the ras etc. are of unequal strength, the potent overcomes the weaker one, which is governed by the rule of nature, as the stronger overpowers the weaker in case of incompatible combination. Even in case of inequality of strength, ras etc. performs their own action due to their inherent property. Conclusion. Ras, Guna, Vipak, Virya and Prabhav are properties which residue in Dravya which exerts action on this basis. While exploiting the drug action, one has keep in mind all these factors considering their relative strength. Ras is the basic thing which is overpowered by Vipak, which again is subdued by Virya, and Prabhav stands above all. References are there. Thank you.
Thank you, Dr. Sneha. Next, I
Thank
would
you.
like to invite Dr. Sarita for the paper presentation on the topic Patra Bhojan, a healthy alternative to modern disposable dishware. Dr. Sarita, are you there? Dr. Sarita?
Yes, sir. Yes, sir. I'm here.
Okay, doctor. Please share the screen, doctor.
Is my screen is visible, sir?
Yes, doctor. Visible, doctor.
Should I start, sir? Am I audible enough?
Yes, doctor. Please start the session, doctor.
To all the panel members for the session and all other Ayurveda enthusiastic listeners present during the session, good evening and pranam. Myself, Dr. Sarita Murade, third year PG student of Swasthabhutta and Yoga Department of Sumatibai Shah Ayurved Mahavidyalaya, Hadapsar, Pune. Today, I am going to present paper on topic Patra Bhojana, a healthy alternative to modern disposable dishware, guided by Vaidya Nitesh Joshi sir. Here all of you will equally agree that due to urbanization and increased industrialization of society, we keep seeking for ready-to-use options available from the market. More importantly, to save time. It may or may not be economical and at the same time not necessarily environment friendly too. From various gadgets, accessories and household material that we use are turning into trash on every other day. Disposable dishware is one of all these trash. Dining tables of many large gatherings without them is now hard to imagine. Let me know you all that this use and throw material system not only harming our unique quality, that is human creativity, but also risking our health and polluting environment in every possible way. So in today's session, I want to put some environment friendly options for disposable dishware explained in Kayadeva Nighantu, their health benefits and other benefits in front of you. Have you heard about various Patra Bhojana options rather traditionally? Some among you may have heard or some may not, right? So, the aim of this session is to identify Herbal Patra Bhojana options mentioned in Kayadeva Nighantu. Objective for the paper presentations are to understand various Bhojana Patra mentioned in Kayadeva Nighantu and their useful benefits in healthy and ill person, to underline how these healthy Patra Bhojana options will economically and ecologically beneficial over disposable dishware. Introduction. India has a long-standing tradition of having meal on banana leaf on auspicious occasions, especially in South India. This practice is not only economical but is more importantly eco-friendly. Keeping this in mind, in today's session, like banana leaf, various plant mentioned in Kayadeva Nighantu as Bhojana Patra have been reviewed. Their health benefits have been noted and will be explained during the session. Acharya Kayadeva have explained this Bhojana Patra in Kayadeva Nighantu under Vihara Varga section. Starting from the Kadali Patra, that is well-known banana leaf, the Bhojana on banana leaf will be Vatashleshmahara and Shushka in properties. While Kutaja Patra Bhojana is Deepana, Rucha, Vishtambakarak, Pittala, increases Vata dosha, Ruksha and Ushna along with Kruminashak properties. Sriparni Tatha Gambhari Patra Bhojana will be Trishna, Daha and Rakta Pitta Nashak in properties. Arkapatra Bhojana will be Ruksha, Shofa तथा Anilahara properties. Palashapatra Bhojana will be Pitta Vruddhikara, Vata Shuddhikara, Parama Shleshmahara, Gulma Dosha Nashaka and useful in various Udara Rogas. Shakapatra Bhojana will be Pittala and has have Vata-Kapha-nashak properties. Erandapatra bhojana will be pittal and have Vata-Kapha-nashak properties. Mahakaurudaka tatha Kadamba patra bhojana will be have Ruksha and Vatakarak properties but causes cessation of Vata-Kapha. Nekroda अर्थात वटपत्र भोजना is helpful in reducing kandu, krumi, having Vishanashak properties and beneficial in Meda and Meha rogas. It increases appetite and Agnibala too. Patalipatra bhojana compromises of Vatakaphanashak properties and is beneficial in Panduroga, Shofa and have Somaroganashak properties. Ketaki Patra, which is traditionally offered to Lord Ganesha during Ganesh festival, have Vatakaphanashak, Raktapittanashak as well as Sarvagrantinashak properties. After all these, we will overlook what are the benefits of using natural disposable dishes. They can be used for both ill and healthy person, can be used as food and vegetable wrappers rather than using aluminum foil or plastic bags, will be environment friendly choice in large functions instead of disposable dishes as they take long time to decompose and harms environment, available naturally at affordable prices. This can encourage plant farming. It will also introduce newer jobs in the form of plant caretaker, harvester, rolling cleaner, dishmaker, transporter, distributor for freshly prepared dishes, recollection of used dishes for composting or can be offered to goshalas either. Increased plantation will be helpful to reduce air pollution directly, whereas air and air pollution indirectly, as they can further use for composting or as a food for animals. While concluding the session, I will like to say that healthy environment is basic right of every individual and keeping it healthy is basic duty. Welcoming eco-friendly options is need of an hour and every smallest step will be countable. Our traditional science, though have scientific values, our ancestors have failed explained it scientifically. So for an Ayurveda enthusiast, it's our duty to elaborate the traditional methods more scientifically so that these methods can be practiced worldwide. Thank you.
Thank you, Dr. Sarita.
Thank you, sir.
Next, I would like to invite Dr. Nikita Abhijit Khabale for the paper presentation on the topic Samyoga Viruddha Ahara in today's perspective. Dr. Nikita, are you there?
Yes, sir.
Doctor, please share the screen, doctor.
Just one second.
Okay, doctor.
Sir, I'm facing some issues. And the screen is not, I can't share the screen.
Okay, doctor, 1 minute. Can you retry the sharing, doctor?
Yes, sir. Sir, my screen is visible.
Not visible, doctor.
So now my screen is visible.
No, doctor, not visible. Okay, doctor. I will share for you, doctor.
Yes, sir.
Okay. Okay, doctor. Please start the session, doctor.
Okay. Good evening, everyone. Myself, Dr. Nikita Khabale Patil, PG final year, Department of Svastavritta and Yoga Department, guided by Dr. Ramesh Ujwale, HOD of Svastavritta and Yoga Department, SSM, Hadapsar, Pune. My today's topic is Sanyog Viruddha Ahara in today's perspective. Introduction. Viruddha Ahara or incompatible diet is a very important contribution discussed by ancient Ayurveda acharyas, which is known to be cause of many systemic disorders. In present era, it is important to understand the mechanism of how Viruddha Ahara is cause of many metabolic disorders. It is essential to know certain food combinations which interact with each other and create many of the systemic disorders. Aim and objectives. Viruddha Ahara Lakshana, definition of Sanyog Viruddha Ahara, examples, diseases caused by Viruddha Ahara, treatment and Sanyog Viruddha Ahara in today's perspective. Viruddha means contrast or opposite in particular. Acharya Charaka has defined Viruddha Ahara as a certain food products or combinations which interrupt the metabolism of the tissues, which inhibit the process of formation of tissues and which have the opposite property to the tissues are called Viruddha Ahara. Viruddha Ahara Lakshana, according to Acharya Charaka, all kinds of foods or medicines which aggravate or increases the doshas from its normal state but do not expel them out of the body and all of them become unhealthy for body is called as Viruddha or incompatible diet. Classification of Viruddha Ahara. Acharya Charaka has explained 18 types of Viruddha Ahara, though they have explained number of examples of food incompatibility in the Samhitas, but some of the food combinations are not used in present era. Etymology. The word Sanyoga is originated from the root Sanyuja or from some plus yoga means combination. Combination of two or more substances together is Sanyoga. Consuming food items which are not supposed to combine with each other is Sanyog Viruddha. Now let's see the most common Sanyog Viruddha Ahara examples in today's era. Examples of milk is incompatible with meat, fish, sour fruits, banana and curd. So the most favorite dish of today's era is fruity milkshake, fruit ice cream, smoothies and fruit salads should be avoided because Amla Varga plus fruit is having Amla Varga plus Dugdha, it is Sanyog Viruddha. Milk which contain lactogen and certain fruits such as bananas which also contain common allergens may aggravate an asthmatic attack. Banana with curd, milk or buttermilk not recommended because banana with buttermilk is taste contradictory. Radish is incompatible with fish. Anup mouse with masha, shaudra and shira. Most common or most popular breakfast in Indian people is tea including milk or milk with chapati or rotis, which is also Sanyog Viruddha. Some of don'ts: raw food with cooked food, sheer with lavana, milkshake of citrus fruits, any meat with honey, milk pudding, alcohol and khichdi, sizzling brownie with ice cream. Pathogenesis of the Viruddha Ahara. When we consume the Viruddha Ahara, it will create the ama. This ama can lead to ama visha and agnimandya. This ama visha can also produce the visuchika and ulcer. Agnimandya can cause obstruction of the channels or srotorod. This srotorod causes the vitiation of the dhatus. This vitiation of the dhatus can produce the garavish. Viruddha Ahara can also vitiate the food. This can also lead to annava srotodushti and raktadushti, which can lead to skin diseases or blood disorders. This vitiation of food also deadly poisonous and which can also lead to death. Diseases caused by the Viruddha Ahara. The continuous consumption of Viruddha Ahara has an impact on up to Shukra Dhatu Dushti, immunity, circulation, and also digestive, endocrine, and the nervous system. The consumption of Viruddha Ahara produces disease, weakness of sense organs, and even hazardous effects like death. Sanyog Viruddha Ahara in today's perspective. Viruddha Ahara can lead to inflammation at molecular level. We have to identify new food incompatibilities which are used today in day-to-day life as per the Ayurvedic perspective. Such food combinations can prove harmful which may cause untoward effects on immune system, cellular metabolism, growth hormone. From the mechanism of action of Viruddhahara, that is Hetu, is the main etiological factor of aggravation of all the diseases. Prevention of the cause plays a major role in all the disease treatment. Viruddhahara is the origin of the most of the diseases. Regular consumption of the Viruddhahara can lead to inflammation at molecular level, ending in creation of arachidonic acid, which is finally result into the increased level of prostaglandin 2 and thromboxane. These inflammatory consequences lies behind the basic pathologies that create the Agrimandya, AMO, and a number of metabolic disorders. This type of studies would suggest that the regular consumption of the Sanyog Viruddha Ahara would lead to maldigestion, bad impact on immune system. Treatment of disease produced by the Viruddha Ahara. Shodhan, Shaman, and Nidan Parivarjan. Shodhan Chikitsa. Shodhan means exclude all the Vigunit or Dushta doshas from the body with the help of Vamana and Virechan. For Viruddhahara, Virechan is preferably used than Vamana. But Shodhan can be useful treatment only when the long-term history of the regular consumption of Viruddhahara is there. Shamana Chikitsa, when the person is not a regular consumer of Viruddhahara and Sharir dosha are not much aggravated than by using drugs having exactly opposite properties to that of Viruddhahara, can settle down the Virukta dosha. Administration of the substances which are converse qualities means Nidan Parivarjan. Prevention is always better than cure. By consuming the healthy and Pathyakar Ahara and avoiding consumption of Viruddhahara, one can prevent himself from all the hazardous effects of Viruddhahara. This is actually the first step towards the treatment of the disease caused by the Viruddhahara. Conclusion: Viruddhahara shows its effects from Rasa Dhatu to Shukra Dhatu. That is, it affects all the dhatus, which shows its severity of consequences, which leads to many systemic disorders, and it also acts as a gene level, which reveals that it is cause for many diseases of unknown etiology and also cause the carcinogenesis. So, in order to prevent this deadly disorder, one has to take the preliminary step of the preventing the intake of Viruddhahara in our day-to-day life. Thank you.
Thank you, Dr. Nikita. Next, I would like to invite Dr. Gopika C for the paper presentation on the topic Analysis of Karya and Karna with respect to the Nidhanas of Kalitya. Dr. Gopika?
Yes, sir. Am I audible?
Yes, doctor.
Please give me a minute, sir. I shall send my screen.
Okay, doctor.
Sir, is my screen visible?
Not visible, doctor.
Sir, now is it visible?
Now it's visible, doctor.
Sir, can I start?
Sure, doctor. Please start the session.
Namaste all. A very good evening to one and all present here. Myself, Dr. Gopika C, final year PG scholar from the Department of PG Studies in Ayurveda Samhita and Siddhanta from Sri Sri College of Ayurvedic Science and Research Hospital, Bengaluru. This presentation is being guided by Dr. Sri Nagesh K.A. The title of my study is Analysis of Karya and Karana with special reference to the Nidhanas of Kalitya. Let's move on to the contents of today's presentation. My presentation will be consisting about introduction, methodology, review of literature, discussion, conclusion, and references. And moving on to the introduction, Nidhanas are causes which are responsible for the Roga Utpatti, which helps to understand the Roga and thereby to determine the accurate treatment principle. Kalitya, which may be correlated to as hair fall, has become a burning issue nowadays. In Ayurveda classics, the exact Karana for Kalitya is not found in a single context. Detailed knowledge of Karana helps in eliciting the link between the Karya and Karana, as without a Karana, a Karya doesn't happen. If the causes of Kalitya are known, then we can prevent the disease up to a certain extent and can understand the link between the Nidana and Dosha, for which the treatment can be planned accordingly. This also helps the physician to improve and modify the conventional method of the case taking, that is the Prashna Pariksha according to Ayurveda, with a clear cut and limited questions regarding the disease. Let's move on to the methodology. So I have carried out a literary study here, and the steps followed are: initially I have done a detailed review about the Khalitya Nidana, Samprapti, and review about the Karya and Karana from various Ayurvedic classics. Followed by the classification of the obtained nidanas was done based on the aharaja, viharaja, manasika, and anya karanas, and was categorized. And then I have done the analysis of the doshic influence with the respective gunas which are involved in the each nidana for further analysis, and a critical analysis have been done. Followed by the application of the various fundamental postulates in disease with special reference to Khalitya was done. Moving on to review of literature. Initially, let's start with the introduction to Nidana. The Nidana is derived from Ni and Dat Karane, Lut Pratyaya. This is the definition according to the Shabda Kalpadruma here, which means into and to bind. And the definition of the Nidanas goes like this. According to Acharya Chakrapani of Charaka Samhita, he has quoted, Nidana is Tatra Vyadhi Janakam Nidanam Hetuhu, which means the reason for the origin of a disease is called as Nidana. Acharya Chakrapani again quoted it as Nidanam Karanam Iha Uchyate. It is the exact cause in all the contexts. And Acharya Madhukosha of Madhav Nidana has quoted, it is the Vyadhi Nishchay Karanam Nidanam. The tool by which a Vyadhi is being decided is Nidana. And let's see an introduction about the Khalitya. The Khalitya Nirukti according to Amarakosha dictionary is Skalanti Kesha Asmat. Here, this term Skalanti means falling of hair. So the falling of hair is Khalitya. Acharya Vagbhada in Ashtangdev Uttarasthana has mentioned that the definition of the Khalitya goes like this: Khalate api janmaivam shatanam tatra tu kramad. Here he has specifically told the gradual falling of the hair is being quoted as Khalitya. Now, the Khalitya Samprapti, which plays an inevitable role in the disease manifestation, to be understood. The shloka goes like this: Roma Kopa Anugam Pittam, Vatena Sahamurchitam, Prachya Vayati Romani Tatah Shleshmasa Shonitaha, Roma Kopan Runadhyasya Tenanveshama Sambhavaha, Tad Indraluptam Rujyamscha Prahuscha Cheti Chapare. So now I have tried the application of the Samskrita Vyakarana in this sutra. Like I have made a Dandanvaya Krama to understand the shloka in detail with the influence of Sanskrit grammar. So I have tried to make the sentences like the shlokas into a sentence format. So the initial line will be like Vatena Sahamurchitam Roma Kopanugam Pittam Romani Prachyavayati, which means along with the Vata, which has already vitiated the Pitta. So here we could understand that the Pitta will be the Pradhana dosha and the Vata will be the Anubandha dosha. This will do the Sthana Samshaya in the Roma Kopas and does the Prachyavayana of the Romas. Prachyavayana is, this means the Prakarshena Chavana, that means the loosening of the hair follicles. Tataha Pratyavaita Sa Shonitaha Shleshma Roma Kupan Runadhi. This Pratyavaita doshas along with the Shonita and the Shleshma does the obstruction of the Roma Kopas, and Tena Anyesham, that is Romnam Utpattihi Asambhavaha. This leads to the Asambhava or the Romnam Utpattir Asambhavaha, which leads to the difficulty in the which deals to the difficulty in the regrowth of the hair. Tat Indraluptam cha Rujya Chacha iti cha apare prahuhu. These are the synonyms of the Khalitya, that is Indralupta, Rujya and Chacha according to Acharya Arunadatta. Now let's see what are the Khalitya Nidanas which I have obtained through the this literary study. Initially, I'll be explaining about the Aharaja Nidanas, that is Lavana Ahara Atisevana, Amla Ahara Atisevana, Kshara Atisevana, Guru Ahara Atisevana, Ati Madhyapana, Harita Shaka Atisevana, Hima Ahara and the Hima Dravya Pana Atisevana, and Lavana Ahara with the Kshira, which leads to the Virya Viruddha context here. And the Viharaj Nidanas were found to be like Pragvata Atisevana, Atihima Semana, Dhuma Rajo Atisevana, Ratri Jagarana Atisevana, Ushnajala Shirosnana, Atapa Atisevana, Bashpa Nigraha Atisevana, Ati Maidhuna, Divaswapna Atisevana, Ati Pralapa. And the Anya Karanas were found to be Abhyanga Dvesha, and Manasika Nidanas were found to be Ati Chintana. And let's see an introduction about the Karya and Karana. Here the Karana is Karya Niyata Purvavrittir Karanam. This is the explanation according to Tarka Sangraha. The one which is existing prior to specific Karya is called as Karana. And the Karikavali has explained that Ananyatha Siddhi Shunyasya Niyata Purvavartita Karanatvam Bhavetasya Traividyam Pirikirtitam. So there are specific factors to establish the Lakshana of Karana. First one is Purvavrititva, that is the antecedents. Karana exists before the Karya, and Niyatatva, which is the invariable in that process. Whenever there a Karya is existing, Karana should also exist invariably, without which any Karya is not manifested. And the third factor is Ananyata Siddhi or Anyatha Siddhi Shunyatva, which means the unconditional relationship, or it is the factor which is more essential in the manifestation of Karana. And Tarka Sangraha Acharya has mentioned that we have three types of Karana: Karanam Trividham, Samavaya Samavaya Nimitta Bedhat. Samavaya Karanas are the direct intimate causes. Asamavaya Karanas are the indirect causes or non-intimate causes, and Nimitta Karanas are the material causes. And Karya is defined as Karyam Pragabhava Pratiyogihi. This is also according to Tarka Sangraha, and the Karya is the factor which is absent before its production. Now let's move on to the discussion. Here I have analyzed the all Nidanas along with the Khalitya in order to establish the basic postulates of Ayurveda, that is the Dravya Siddhanta, Guna Siddhanta, and Karma Siddhanta, and possibly it has been interpreted. So let's see. In Guru Ahara Atisevana, here the Dravya itself are the Tridosha. So in Guru Ahara Atisevana, what will happen is the Kapha dosha is getting vitiated. Because of it, the gunas like Guru, Snigdha, and Manda is being vitiated, which leads to the Stambhana Karma. And in Lavana Ahara Atisevana, Pitta and Kapha, which the gunas vitiated are Sneha, Ushna, and Gurutva, which leads to the Stambhana, Snehana, and Svedana. Shita Jala Atisevana, Vata is the dosha vitiated, and the gunas are Shita, Laghu, and Ruksha. Stambhana and Rukshana will be happening. And in Amla Ahara Atisevana, Kapha, Pitta, and Rakta are all simultaneously vitiated with the gunas like Snigdha, Ushna, and Laghu vitiation, which leads to the Snigdhata and Shitilata. And Kshara Atisevana, Vata and Pitta is vitiated with the gunas of Ruksha, Sukshma, Sthara, and Drava, which leads to the Rukshana and Langhana Karma. Harita Shaka Atisevana, Vata is the dosha which is vitiated, and the gunas are Ruksha, Laghu, and Shita, and which leads to the Rukshana and Langhana. Lavana Ahara and Kshira Prayoga Atisevana, Tridosha and the Rakta is vitiated simultaneously, which has a direct impact over the all dhatus, and thus it leads to the Stambhana and Dhatukshaya. In case of Pragvata Atisevana, Vata and Pitta is vitiated, which leads to the Ruksha, Tikshna, Ushna, and Dravatva increase, leading to the Svedana and Langhana. Divaswapna Atisevana, Kapha and Pitta is vitiated, which leads to the Snigdha, Guru, and Shita, and the Snehana and Brahmana is the Karma. In Atihima Sevana and Ratri Jagarana, both Vata is the dosha vitiated, which leads to the Stambhana and Rukshana and Langhana respectively. In Ushna Jala Shirosnana, Pitta is the dosha vitiated, which leads to the Ushna and Dravatva vitiation, followed by Svedana Karma. In Atichintana, Vata is the Dravya which is vitiated, followed by the Chalatva of the Vata is increased, leading to the Chintyam and Rukshana Karma. In Darunaka case, that is the Purva Vyadhi Vrittanta, Vata and Pitta is vitiated, leading to the Ruksha and Laghutva of the Kesha Bhumi, leading to the Rukshana Karma. In Atapa Atisevana and Rajodhuma Atisevana, Bashpagraha, Atimaidhuna, Pralapa, and Atimadhyapana, Vata as well as Vata Pitta is also vitiated, leading to the Svedana, Langhana, Stambhana, Rukshana karmas respectively. Now let's see the relation between the Nidana, Dosha, and Dushya, which is the major factors which are important in the manifestation of a Vyadhi. So the first table shows the association between the Nidana, Dosha, and Dushya. If there is no association, there will not be any Vyadhi Abhinirvrittihi. So Vyadhi will be absent. So Vyadhi Abhava. And if the association is late, then it will be like Abhinirvritti will be there, but the prolonged cause or delayed manifestation of the Vyadhi will happen, which can be called as a Chirakari Vyadhi. If the association is weak or insufficient, then it can lead to unclear manifestation, then we can call it as Mridu Vyadhi. If the manifestation is sudden, then the sudden manifestation of the Vyadhi also will happen, like Visha or something, which can be led to the Shikrakari Vyadhi. And if the factors are very powerfully associated, it leads to the strong manifestation with clear-cut symptoms, and which leads to the Upadravas. Then the disease becomes the Asadhya. And now let's see the status of the various karana bhedas in a process of disease manifestation. So if the samavai karana is there, and in that karya condition, it should be present before, during, and after the process of the karya manifestation. In case of asamavai karana, it can be absent before and after the karya, but whenever the karya is happening, in that moment asamavai karana should be inevitably present. In nimitta karana can be present before but need not to be present during and after the disease manifestation. Similarly in Khalitya also. Now I have tried to categorize the various types of karana with taking an example of Khalitya here. So Samavai Karanas in case of Khalitya will be the Tridoshas, that is Vata, Pitta and Kapha, without which Khalitya is never going to happen. In Asamavai Karana, here the Dosha Doshi Samurchana can be considered as an Asamavai Karana, and also the Rakta Dosha, which is a Dhatu, can be also considered as a Asamavai Karana here. The association between the Vata and Pitta along with the Rasa Dhatu is the first stage Samprapti, followed by the association of the Rakta and Kapha, that is the second stage Samprapti, is the Asamavai Karana. And coming to the Nimitta Karana in Kalitya, all the Nidanas, that is Aharaja, Vihara, Anya, and Manasika Karanas can be considered as the Nimitta Karanas. Moving on to the conclusion, despite the fact that Nidanas are classified in a variety of ways, everything may be grouped under Trini Ayatanani since they are the root causes of all Vyadhis. Khaliti Samprapti is a two-stage procedure that continues even after the hair follicles have become loose. Pitta and Vata cause hair follicles to relax from hair roots, whilst Kapha and Rakta causes Roma kupas to become obstructed. Among the Nidanas of Khalitya, at least one Nidana should be present existing to the manifestation of Khalitya. If Khalitya is manifested, any among the mentioned Nidana should be invariably present before its manifestation. In case of multiple Nidanas, it is always mandatory to have a strong Nidana which is capable of manifesting the disease. These are the references of my study. Thank you.
Hi, Doctor. Dr. Gopika.
Yes, ma'am.
Actually, no, how you, this is your thesis topic?
Yes, ma'am.
Actually, how you did the survey of these much Nidanas?
Ma'am, it was a survey study which consisted around 370 samples, and the survey was conducted in Kerala as well as in Sri Sri College, Bangalore. And the survey study was an open label study, like it was done convenient sampling was done, and the questionnaire was standardized from 5 different universities, which consisted around 25 questions, which was included here as the Nidanas here. And among that, we could find around 11 were statistically significant, and all the other Nidanas were found to be weakly associated with Khalitya, but all the 25 Nidanas were found to be clinically significant, ma'am.
Okay, in that, no, how much percentage, which one have the most reliable you got in the survey?
Ma'am, actually the strongly associated Nidanas were found to be from Amla Ahara Atisevana, Lavana Ahara Atisevana, Atapa Atisevana, Ratri Jagarana, Ati Madhyapana, and the Manasika Karanas, that is the Ati Chintana, and also Divaswapna had the strong significance, and weakly associated were the remaining, and the not associated with was the history of the Purva Vyadhi Vrittanta. Ma'am, this is absolutely based on the statistical results, but clinically each and every Nidanas were found to be clinically significant.
Actually, no, in all the Nidanas here included, no, in untimely food. Actually, we have that Ahara Vidhyadhyaya also there, no, Charaga.
Yes, ma'am.
In that, no, he explained the timely food, the importance of that. And in whether you have included any of the questions inside that, like if he's skipping the breakfast or he's skipping the lunch, like that. Any questions you have added in the Aharaja?
No, ma'am. Regarding Ahara, like only heavy meal intake was included here, and it was standardized, and remaining questions were completely deleted by the SPSS software.
Actually, no, that was an important point while taking. Whenever a clinically, this is an actually, we know that's a theoretical, we have these much questions. When a patient is approaching us in clinically, no, there is a much importance for the untimely food. If the patient is skipping the breakfast, there will be Vada Pitta Prakopa will be there. In Khalitya also we can see that Vada Pitta predominance. If he is skipping the lunch also, he has the same dosha predominance. Dosha will be there, no?
Ma'am,
will
actually, the
be
first objective of my study was to compile the Nidanas which are available in the Ayurvedic classics. So I couldn't get any evidence from under this Ahara Vidhi Vishesha Ayatana. So I have not included it, ma'am.
No,
Definitely,
actually,
whenever.
we have to add that. Again, Ahara Vidhi, 18 types of Ahara Vidya or Acharya. Inside that, he has Atyamla Sevanam, Adishira Sevanam, everything he has included. Okay. In that
Okay,
also, the Na Adi Vilambadam, Na Adi Drudam, like everything. Akala Bhojanam, Adi Bhojanam, Ajinam, Bhukta Uberi Bhojanam, everything he is explained correctly. Those
Yes, ma'am.
also you have to include. Okay, maybe this is study, okay. But it's clinically more important for the Ahara Vidhi also. Okay, when you are approaching the
Sure, ma'am.
patient, you have to
Ma'am.
keep in your mind. Okay, it's nice
Sure, ma'am.
presentation. One more thing, in
Yes, ma'am.
Darunagano, the Vada Kabha is getting vitiating. No, I think
Yes,
you told
ma'am.
Vada Pitta, you had included that in your chart.
Ma'am, okay, discussion point.
Yeah, no, not in
Okay, ma'am.
discussion. In the chart, you are telling so many nidanas and in which dosha is getting vitiated. No.
Okay,
I
ma'am.
think in
Probable
Darunaga
dosha
actually.
vitiated.
Yeah, actually in Darunaga Vada Kabha is getting vitiating. And
Okay.
you have included Vada Pitta. So
Okay,
that
ma'am.
also
I
you
shall
can check.
change
Okay.
it. Sure,
Okay.
ma'am. I will change it. Thank you,
It's
ma'am.
good presentation.
Thank
Okay.
you so much, ma'am.
Okay.
Thank you, panel. And thank you, Dr. Gopika. Next, I would like to invite Dr. Shilpa Shankar Khatre for the paper presentation on the topic Literature Review on Krivi Roga in Children. Dr. Shilpa, are you there?
Yes, sir. 1 minute, sir.
Okay, doctor.
Hello. Hello.
Hello, doctor. The
1
screen is
minute,
not
sir.
visible, doctor.
I'm unable to share my screen.
Okay, doctor.
Eh, 1 minute, sir. I'm unable to share my screen.
Please try, doctor. The screen is visible, doctor. Please turn on your slide.
Screen is visible?
Yes,
Okay.
doctor.
Okay,
Visible,
sir.
doctor.
Okay. Google Drive. Sorry, sir. Wait.
Hello, doctor. Your
Hello.
voice is breaking, doctor.
Am I?
Okay, your
Am I
screen is
visible,
visible,
sir?
doctor. Screen is visible.
Okay, sir.
Please start the session, doctor.
My topic of presentation is literature review on Krimi Roga, worm infestation in children, guided by Dr. Vijay Kumar Gai, sir. Name of institute is Government Ayurvedic College and Hospital, Nanded. Abstract. Worm infection is a common problem in children, especially in preschool and school-going children. In pediatric practices, especially in developing countries, occur due to poor hygiene, contaminated food, and unfiltered water. The major worm infection includes Ascariasis, Trichomonas, and Enterobiasis. Among which infection in children is Ascariasis lumbricoides. This has been found to lead poor cognitive development, infection, malnutrition, and in children. In Ayurveda, all the term creamy and most authors symptoms and treatment of cream. Is used as a broad sense for all worms and microorganisms of modern science. Creamy are classified into two groups, bile and abdominal. Introduction. Worm infection present in all age, mainly preschool and school children. Prevalence of worm infection in India 20.6%. Boys are included 22% and girls are 13.5%. 6 years to 8 years 21.4%, highly infected with infections. 9 years to 12 years 18.6%, and 13 years to 16 years 10.7%. Gold standard diagnostic technique for evaluation of worm infestation include stomachoscopy for direct egg detection and species identification. Acharya mentioned total 20 clinic and also explained three-way treatment for eradication, which is apakarshana, prakriti vigata, and nidana parivarjana. Apakarshana is a first line of treatment. It contains most forcible sanshadhana, which is vamana, shiro virechana, etc. Prakriti vigata, it means destruction of environment which is susceptible for growth of krimi. And nidana parivarjana means avoid the causal factor. Material and method. The details of concerned information were retrieved from various sources such as literature review of both classic as well as modern, web-based database and published papers. Is analyzed and attempt has been made to learn some fruitful conclusion regarding the relation of krimi with modern parasite and review its treatment by Ayurvedic point of view. Neither now yoga. Eating food over undigested food. Ajirna sweet, sour, and sour overeat. That is amla, lavan, lack of exercise, sleeping habit at daytime, etc. Samprapti of krimi. Hetu sevanam. It leads to agni, and finally
Dr. Shilpa, are you there? Hello, Dr. Shilpa. Dr. Shilpa, please unmute.
hello, sir. Am I audible, sir?
Audible, doctor. Please continue, doctor.
Sorry, sir. Me external.
Doctor, your voice is breaking, doctor. Hello.
Okay, sir. Wait, sir. Hello. Am I audible, sir?
Audible, doctor, but your voice is breaking sometimes.
Okay. Now, sir?
Now, okay,
Am I
doctor.
audible?
Audible,
Okay,
doctor.
sir.
Please continue, doctor.
Yes. Abhyantar krimi, internal worms. This type of infestation may occur due to production of ama, that is toxins, excessive consumption of sweet and sour diet, and viruddhahara. It further classified into three types, which is purishaja, shleshmaja, and raktaja. General symptoms of krimi roga: fever, paleness of skin, cramping pain, heart trouble, lassitude, vertigo, reduced appetite, vomiting, gurgling sound in intestine. Now, treatment of krimi roga. Acharya Charaka described three basic methods for treatment of Koshtagata krimi, such as apakarshana, removal of krimi by Vamanadi Panchakarma procedures, Prakriti Vighata, to create unfavorable environment by means of diet and medicine, Nidan Parivarjana, avoid etiological factor. Now, in detail, apakarshana. The word apakarshana means to scratch the dosha, mala, and krimi sangata forcefully. Apakarshana or removal of bahya krimi, external worms, should be done by manual methods. Apakarshana of abhyantar krimi, which resides in their usual habitat, should be done by elimination methods such as Virechana, Shirovirechana, and Asthapan Basti. Drugs used for Apakarsanam, which is Kapikachu, Palash Bij, Eranda Sneha, Trivrutta, and Kutki. Now Prakriti Vighata. Prakriti which is able to produce Utpataka Karna, and Vighata means to destroy, that is Vinashana. Therefore, overall Prakriti Vighata means to destroy the producing environment. Drug use are Vidanga, Sarpagandha, and Kutaja. Now Nidana Parivarjan. Eliminate the causative factor which promote the germinating and growing of cream. Causes should be avoided like Kaphavardhak Ahara, Madhura Ahara, Snigdha, Guda, Dadi, etc. Ayurvedic preparation by different acharyas for creamy in children that are Asava. It includes Vidangarishtam, Kutajarishta, Bhallatakasava, etc. Churnam, Vidangadi Churnam. Bhasma, Loha Bhasma, Vanga Bhasma, etc. Grita, Vidangadi Gritam, Bimbi Gritam, Rasa, Krimikitha Rasa, and Krimimudga Rasa. Now Pathya Apathya. Pathya include Rasam, Tikta and Katu Rasa Sevanam, Dravam, Takra Siddha Yavagu, and Ushnadak. Dravya Shigru, etc. Now Apathyam. Rasam, Madhura and Amla Rasam, Drava Shita Jalam, Dravya, Guda, and Shushka Mansa. Management. For the treatment of worm, several drugs may be used. Mebendazole, its action is wormicidal. No significant side effect. Dose 100 mg for BD for 3 days. Albendazole, broad spectrum antihelminthic. Children under 2 years, 200 mg, and children beyond 2 years, 400 mg. Parental Pamotine, 11 mg per kg single dose. Maximum dose 1 gram. Repeat after 2 weeks. Ivermectin 0.2 mg per kg per dose. Dose may be repeated after 2 weeks. Piperazine citrate. In intestinal or biliary obstruction, surgical intervention may be needed in cases with severe obstruction. Now control measures. Mass deworming of preschool children every 3 to 6 months. Hygiene sanitary. Excreta disposal practices. Reduce use of human feces as a manure. Personal protection. Food. Ground or root vegetables used for making salad should be thoroughly clean. Beef, pork, and fish should be well cooked to destroy the infective worm of parasite. Water. Drinking water should be boiled or filtered to prevent infection. Skill. Children should encourage to wear the shoes. Health education. Daily bath. Habit of washing hand. Nails should be cut clean with soap and brush. Children should be prevented from irritation and itching of perianal region by using antipruritic cream. Now conclusion. Krimi Roga is a major health problem in school age and preschool age children. It needs proper precaution, control, and treatment. Use of modern medicine to treat worms are having side effects like hallucination, fevers, chills, confusion, nausea, etc. Use of herbal medicine in treatment of worm infestation has been growing because of fewer side effects as compared to molecular medicine. Thank you, sir. Hello.
Thank you, Doctor. Thank you, Dr. Shilpa.
Yes, sir. Thank you.
Next, I would like to invite Dr. Rashmi Muralidhar for the paper presentation on the topic Literature Review on Suvarna Prasha in Children. Dr. Rashmi, are you there? Hello, Dr. Rashmi, are you there?
Yes, sir.
Okay, Doctor, please share the screen, Doctor. Hello, Doctor.
Hello.
Hello, Doctor. You are audible, Doctor. Please share the screen, Doctor. Hello, Dr. Rashmi, are you there? Hello, Dr. Rashmi. I think it was a network issue. Next, I would like to invite Dr. Sushma Bhagwan for the paper presentation on the topic role of Abhyanga in infants. Dr. Sushma, are you there?
Sir, yes.
Okay, doctor.
One
Please share
minute.
the screen, doctor. Okay, doctor.
Yes. Hello. Hello.
Hello, doctor.
Sir, I can. Can you please share the screen?
Okay, doctor. 1 minute, doctor.
Uh-huh.
Doctor, please start the session, doctor.
Yes, sir. Yes. Good evening, everyone. Myself, Dr. Sushma Shalke from Government Ayurvedic College, Nanded. I am presenting role of Abhyanga in infants, guided by Dr. Dattatreya Chavan sir. Introduction. Abhyanga is one of the consequential Ayurvedic procedure. It has again captured its central place amongst the way for healing, preventing diseases, and promoting health. Infant period is foundation of adult human life. Infant care is therefore very important area of health practices. The dramatic growth of infants during first year of life imposes unique care during this period. Abhyanga therapy evident to delay aging, cures tiredness and vata disorders, improves vision, sound sleep, and etc. Indications and contraindications of Abhyanga are indications. It is a safe procedure which can be done on everyone, which is vitally stable. Contraindications of Abhyanga are immediately after feeding, baby with hypoglycemia, sick newborns or infants, baby with lethargy, refusing to feed, having signs of sepsis, congenital heart diseases, respiratory distress requiring oxygen, selection of oil for Abhyanga in Navjat Balak or LBW, Bala Tel, Mahamash Tel, in Vatvyadhi, Mahamash Tel, Mahanarayan Tel, in Stolya, Bruhat Sendavadi Tel or Trifala Tel, in Amwata, Vishagarbha Tel or Mahanarayan Tel. Duration of Abhyanga are 900 matras, which means 45 minutes. Abhyanga procedures, time of procedure, Abhyanga can be done at any time in the day, mostly done in morning time. Procedure, use comfortable warm oil, dip fingertip into the warm oil and apply lightly on the entire body. Abhyanga should be done by using gentle and smooth rhythmical movement. Direction of Abhyanga, Abhyanga should be performed in Anulom Gati for the proper absorption of the oil by follicles. Duration of Abhyanga, Dallon has decoded the relation of time of Abhyanga with nourishment of the 7 tissues. Uh, Duration of Abhyanga in matras, structure and matras. Uh, Structures and matras, hair follicles 300 matras, twacha 400 matras, rakta 500 matras, mass 600 matras, meda 700 matras, asti 800 matras, majja 900 matras. According to काय चिकित्सा हे Kashyap, love of Abhyangar, Nityam tu balanam nishi sneha vibardhanam, hitam nidrakaram balya, vardhanam shramanashanam, tasmascha shashyate nityam balanam parimardhanam. According to Vagbhat, Abhyangam achare nityam sajarashram vataha, drishti prasad pushtayu sapna sutvat dardhakrut. Daily use of Abhyanga helps softness of tissues, sleep, and increases immunity. Benefits of Abhyanga: health and protection, beauty purposes, emotionally well-being. Preterm infant can theoretically increases the chances of infection. There are many babies who develop allergic rash with oil. Abhyanga is the risk of injury. Mode of action of Abhyanga. In Ayurveda, Charaka advocated that Sparshanendriya connects with mind, gives rise to pleasure and pain experiences. Rubbing and friction tend to dilate the orifice of the ducts and increase the temperature of the body. Abhyanga is important procedure to control mind and normal physiology of body. Discussion. Neonatal health is one of the important health challenges faced by developing countries. Abhyanga, which is part of its practice in past and present, it is very effective and economically cheaper method. Prevention of neonatal morbidity is also factor. Keep in mind, discussing the classical texts of Ayurveda, the care of neonate includes Abhyanga, Snan, and etc. Abhyanga increases vagal activity, which may lead to increased gastric motility and thereby weight gain. Conclusion. Abhyanga is one of the important part of Jatmatra Paricharya and very effective to gain weight, reduces pain, enhances immunity, and accelerates the healthy growth and development of baby. Proper selection of oil and with certain precaution under medical supervision and advice, one can practice Abhyanga from birth to lifelong without any harm in the massage to modern health world. In short, it can be concluded that without the therapeutic and pharmacological consideration, it is impossible to obtain the desired therapeutic actions of massage therapy. Following are the references related. Hello.
Thank you, doctor.
Hello.
Next, I would like to invite Dr. Dhanasri for the paper presentation. Dr. Dhanasri, are you there?
Yes, sir. Am I audible?
Audible, doctor. Please share the screen, doctor.
Yes, sir. Is my screen visible, sir?
Screen is not visible, doctor. It shows screen sharing option. Not visible, doctor.
Okay, 1 minute, sir.
Okay, doctor.
How do you unpause it? What is it called? Now, sir, is it visible, sir?
Now visible, doctor. Please start
Yes.
the session, doctor.
Yes, sir. Good evening to one and all. My name is Dr. Dhanashree Goe. I am from Sumatibai Shah Ayurved Mahavidyalaya, Hadapsar, Pune. I'm going to present today's topic, management of allergic rhinitis with Shirishadi Churna Sevan. It's a case study. Okay, so allergic rhinitis, it is an atopic disease. It is IgE mediated immunological response of nasal mucosa to airborne allergens, presenting with symptoms like sneezing, nasal congestion, clear rhinorrhea, and nasal pleuritis. Now it affects 1 in 6 individuals and is associated with significant loss of productive and healthcare costs. Now, what exactly happens in allergic rhinitis? Now, inhaled allergens, they produce a specific IgE antibody in the genetically predisposed individual. Now, these antibodies, they become fixed to the blood basophils or tissue mast cells, and subsequent exposure antigen combines with antibodies, and this reaction produces degranulation of the mast cell, which release several chemical mediators. These mediators are responsible for symptomatology of allergic diseases. Now, next, historically, allergic rhinitis was thought to be a disease process of the nasal airway alone. Still, the development of the unidentified airway theory has classified allergic rhinitis as a component of systemic allergic response with associated conditions such as asthma and atopic dermatitis, sharing an underlying systemic pathology. Some of the clinical features of allergic rhinitis can be correlated with Vataj pratishay. Pratishay being one among the Pranavastrotas vikaras. In management of allergic rhinitis, we are going to have a combination of Shirish, Haridra, Sariva, Kantakari, Yashti Madhu. Now, this is going to be along with mud. It will be given as a chartan to the patient internally. The guna karma of these drugs are Snigdha, Amla, Madhur, Tikta, Kashay, Kapha, and Vatahar. This require and after when they are taking the patient, we take the patients on the basis of their clinical signs, symptoms, as well as we are going to see the eosinophil count of the patient before and after the treatment. Now, study rationale. What is the purpose of this study? Now, purpose of this study is to find out solution for the relief from Vataj pratishay, and the main purpose of this study is to find safe and effective treatment without untoward effects in the management of allergic rhinitis. Now, disease Vataj pratishay, which is due to violation of Vata dosha in nasal region, can be correlated with allergic rhinitis, which is more common nowadays due to increased pollution and changed lifestyle. Introduction. Ayurveda is a natural system of medicine originated in India more than 3,000 years ago. The term Ayurveda is derived from the Sanskrit word Ayur and Veda. Ayur is life and Veda means science of knowledge. Its main aim is to protect the health of the healthy person and cure the disease of the diseased. Allergic rhinitis is a major health problem that has an impact on social, educational, personal, and economic life. It has symptoms like nasal congestion, sneezing, rhinorrhea. It can be categorized as intermittent, that's mild, persistent means moderate to severe. In intermittent, we have these symptoms like for 4 days or for 4 weeks consecutively, whereas in persistent, it is more than 4 weeks. And intermittent, that's mild, you have normal sleep. In persistent, there's abnormal sleep. In mild, there is no impairment of daily activity or sports leisure, whereas in persistent, there is impairment of daily activity. Most of the people with asthma have rhinitis. The presence of allergic rhinitis significantly increased the probability of asthma up to 40%. The prevalence of allergic rhinitis in the United States is approximately 15% on the basis of physician diagnosis and as high as 30% on the basis of self-reported nasal symptoms. Furthermore, its prevalence may be increasing over time as suggested by some studies in various countries. Now, what will give treatment? What is the treatment according to the modern science? The treatment according to modern science, it's mostly divided into 3. First is avoidance of allergen that we call as Nidan Parivarjan. Second is treatment with disease. Third is immunotherapy. Now, what is avoid of allergens? This is the most successful if the antigen is only one, like removal of a pet from the house, removing of the mattress, public sheets, or the place you're working from where you are getting this allergy. If you change that, you have relief from your symptoms. Second is treatment with disease, treatment with drugs, that is antihistaminics, corticosteroids. Now, antihistaminics, they control rhinorrhea, sneezing, and pruritus. All antihistaminics have side effects like drowsiness, and some have more than the others. Whereas corticosteroids, they are also very effective in controlling the symptoms. But the thing is that corticosteroids mostly make the patient dependent. They give relief, but they have patient tend to have dependency on them, and constant of make the patient dependence, as well as they do not give complete relief. Hence, to provide efficient, better, and long-term cure through Ayurveda, so the study is planned. Like oral churna, including 5 drugs along with honey, is given to the disease. In pratishay, there is dushti of Vata dosha. In pratishay, there is, hence we choose these drugs that are Ushna, Tikta, Kashay, Vata Shamak, and Kafahar. In Uttar Tantra, Pratishay Pratished Adhyay, Acharya Shushruta has explained symptoms of Vataj Pratishay like Anada, Pihita, Tanustrav, Kshavatu, which are just like allergic rhinitis, that is nasal block, rhinorrhea, and common sneezing. In Chikitsastam, Trimarmiya Adhyay, Acharya Charak has explained the importance of Snigdha, Lagu, Ushna, Amla, Rasatmak Dravyas, importance in Vataj Pratishay. Hence, we are using these drugs, Shirish, Haridra, Sariva, Kantakari, Yashti Madhu, which are Ushna, Lagu, Snigdha, Kashay, Tikta, Vata, and Kafar in the treatment of Vataj Pratishay. Classification. The classification of allergic rhinitis. It can be according to acute and early phase, or as well as late or delayed phase. Acute phase means it occurs immediately within 5 to 30 minutes. Late is it occurs 2 to 8 hours after exposure to allergens. One more classification is seasonal and perennial. Seasonal is symptoms appears in and around a particular season when the pollens of particular plant to which the patient is sensitive are present in the air. Perennial symptoms occurs throughout the year. Now, what is how correlation of allergic rhinitis with pratishay? In allergic rhinitis, there is breathlessness, which is called as krucha swashan. We call in pratishay. Sneezing and pratatashwas. Nasal congestion in nasal araktata. Nasal discharge, nasastrav. Headache, shirashul. Now, the purpose of this study is to manage the case of allergic rhinitis with Ayurvedic drugs. A. To study the effect of Madhu Saha Abhyantar Shirishadi Churna Sevan in the management of allergic rhinitis. Now, objective: to find safe and appropriate Ayurvedic treatment without any adverse effect in allergic rhinitis. Materials and method. Study design: 5 patients from the age group of 20 and 50 are 20 to 50 were selected for the study of allergic rhinitis with prior consent taken. There was no any history of major illness, surgical illness, addiction, known drug allergy. The eosinophil count of the patient was taken before and after the treatment. Treatment plan was this 5 churna, which was mixed together, then half a teaspoon BD with for 7 days with honey. Now, what Shirish? These 5 drugs, Shirish, Alziba, Libec, Fabaceae family, Guna, it is Ushna, Tiktak, Shai, Tritoshavna, and Prayog, Kasahar. Haridra, Curcuma longa, family Zinziberaceae, Guna, it is Ushna. Kafahar, Vatar, Grahi, and Pratishay. Sariva, Hemidesmus indicis, Asclepidaceae family, Guna, Laghu. Shwas, Aruchi. Prayog in Shwas and Aruchi. Kantakari, Solanum xanthocarpum, Solanaceae family, Guna, Katu Kafahar, Agnivardak. Prayog, Kafanisarak, Kasa, Shwasa, Pratishay. Yashti Madhu, Glyceria glabra, family Leguminosae, Madur Ushna, Swarbhanga, Kas, आणि Kafanisarak. Now, Acharya Charaka and Sutrastan Annapan Vidhi Adhyaya has explained that guna of madhu, why we chose madhu with these along with these drugs as chatan. That is the explanation. Acharya Charaka and Sutrastan Annapan Vidhi Adhyaya has explained that guna of madhu being guru, sheet, ruksha, kshaya, madhur, rasatmak, raktapitta, and kapha vikar nashak. Hence, it is used as annapan along with this drug. Treatment protocol: the patient were diagnosed on basis of their symptoms of allergic rhinitis. The treatment were explained thoroughly to the patient. They were given medicine and were asked to give follow-up after 7 days. Administration details: they are 20 grams or 25 gram churna packets of these drugs. They were told to the patient to buy them mixed together, and then they given half teaspoon of churna along with honey morning and evening. What were the observation? On day 1, there was rhinorrhea, nasal congestion, sneezing, and headache, which was very much. After that, on the 3rd day, it was mild, and it was moderate to mild, and then 7th day, it was much relief the patient had. Discussion in Shushruta Samhita. This is the pie chart of how observations. Discussion in Shushruta Samhita Vataj Pratishay. It is mentioned under Pratishay Pratishet Adhyay, its management, it's mentioned in Uttar Tantra. Also, Acharya Vagbhat has mentioned Abhyantar Chikitsa in Vagbhat Uttar Tantra, from where Acharya Vagbhat has explained Abhyantar Ahar, Aushadhi Sevan, along with Dhumpan, Nasya, and Svedan. Acharya Charaka has explained that importance of Lagu, Ushna, Amla food and medicines in the treatment of Vataj Pratishay. The goal of the study is to reduce frequency and severity of the attacks of Vataj Pratishay. On the basis of today's lifestyle, the study was concentrated on the thoughts of quick, effective, and easy way to take the medicine in form of churna mixed with honey. these are the references from where I chose my study. Thank you.
Thank you, Dr. Dhanasri.
Yes, sir.
Next, I would like to invite Dr. Prerna Santosh Videkar for the paper presentation on the topic Effective Siraveda on Varicose Vein case study. Dr. Prerna, are you there? Dr. Prerna, are you there?
Yes, sir, I'm here.
Okay, doctor. Please share the screen, doctor. The screen is visible, doctor. Please start the session.
Good evening, everyone. This is Dr. Prerna Bandekar. I work in ADMC, Sangli. Moving towards my presentation, title is Effect of Siraveda on Varicose Vein, a case study. Introduction. In this article, a case study in varicose vein has been taken for understanding the relieveness of complaints presented by an 18-year-old boy who has visited the outpatient department. The common site of the varicosity or superficial venous system of the lower limbs and upper limb varicosity are rare. It affects either the long or short saphenous vein or both. The superficial veins and perforating veins connects the superficial with deep veins. The primary causes of varicose veins are the incompetency of the walls and weakness in the wall of vein, which causes venous insufficiency. Secondary varicose vein occur due to venous obstruction caused by pregnancy, tumors in the pelvis, fibroid, ovarian cyst, and deep vein thrombosis. In Ayurveda classic, varicose vein can be very much correlated with the sign and symptoms assigned for Siragrandhi, which is obstructive circulation. A case report, a 18-year male patient, he came to us 17 December 2021 with chief complaint of Dakshina Vamahasta Shul, pain at both hands, Shotha and Dakshina Vamahasta, toxicity of vein over both hands. Patient had above complaints since last 15 days. Personal history, dietary habit, mixed daily activities, sports and running. दशविध परीक्षा प्रकृति वात कफा विकृति हेतु असात्म्य भोजना अतिव्यायाम दोष वात प्रधान त्रिदोष दुष्य सिरा उपधातु रक्त देश साधारण बाल बल मध्यम अष्टस्थान परीक्षा नाड़ी 78 per minute, मूत्र प्राकृत, मल प्राकृत, जिह्वा प्राकृत, शब्द प्राकृत, स्पर्श प्राकृत, आकृति मध्यम. Local examination done on 17 December 2021. On inspection, there was a toxicity of vein over both hands, pain present at left hand, duration since 1 year, and diagnosis of Siragrandhi. Material and methods, Center of Study, Honorable Anna Sahib Dange Ayurved College, Postgraduate and Research Center, Ashta, Sangli. Simple random single case study. Material, in table number 1, internal medicine was given, that is capsule Viscovas 250 mg 2 bd after food, Anupana is Koshna Jala, and Mahamanjishtadi Kashaya 20 ml bd before food, Anupana Koshna Jala. In table number 2, Siraveda procedure. In Purva Karma, written consent of patient taken. All pre-procedures investigation like RBS, BTCT was done and they were under normal range. All instruments required for procedure were prepared. In Pradhan Karma, Siraveda done on left hand with all safety precautions. And Pashat Karma, hemostasis achieved. Diet and regimen advised to the patient. In table number 3, showing regression of symptoms during treatment. In pain, on 17/12/2021, there was severe pain. On 31/12/2021, it was mild. And on 14/1 and 31/1/2022, pain was relieved. And toxicity of vein over left hand, on 17/12/2021, it was severe. On 31/12/2021, it was moderate. And on 14/1/2022, it was a mild. On 31/1/2022, tortuosity of vein over left hand subset. Result: the clinical feature of varicose vein were improved in fifth peak, pain and varicosity were reduced. Discussion: the accumulation of rakta and visheshan of vata in siras leads to sira akunchana, that is dilatation of the veins, and vakrikarna, that is tortuosity. This causes local congestion in that area, causing shula and shota. Repeated bloodletting by Siraveda brings down the local shota by relieving the local congestion, which contains metabolic toxins, debris of the dead tissues. By removing vitiated blood first, so part of shota is relieved in first phase. Healthy and nourishing blood is supplied to that tissue where the stasis is cleared off. This promotes the regaining of the health of surrounding tissue as well as the vessel wall, which takes little time, that is second phase, and thus by removing the stagnant vitiated blood that had used Sanghas Siraveda reduces localized intravascular pressure and volume, hence relieving shula and shota. Toxicity was only partially relieved in the study. The reason might be its mechanical defect, and the tension in the area is only partially relieved. It was seen often associated with shota due to stagnation of dushta. Conclusion: Siraveda showed early result reducing the sign and symptoms of Siragrandhi, especially in the symptoms like shula and shota. After the follow-up period of the 1 month, the procedure showed no recurrence, which highlight it as an effective long-term remedy for varicose veins. These are the references. Thank you.
Thank you, Doctor. Next, I would like to invite Dr. Rashmi for the paper presentation on the topic literature review on Suvarna Prasha in children.
Yes,
Dr. Rashmi?
sir.
Okay,
Yes,
Doctor.
sir. Am I audible, sir?
Audible, Doctor.
Hello?
Audible,
Okay.
Doctor.
Can you please share? Okay. Okay. Thank you, sir. Hello. Good evening, everyone. Am I audible?
Audible, Doctor. Please continue, Doctor.
Okay. Thank you, sir. Good evening, everyone. Today, my paper presentation on a topic overview of Suvarna Prashana in Ayurvedic pediatric clinical practices. Guided by Dr. Dattatra Chavan, sir, Associate Professor and Guide. Myself, Dr. Rashmi Ingre, PG third year Balroga Department, Government Ayurvedic College, Nanded. Outline of my today's presentations are aim and objectives, indication and contraindications, forms of Swarna, method of making the Swarna Prashana, doses and schedule of Swarna Prashana, role of content of Swarna Prashana, benefits of Swarna Prashana, discussion, conclusion, and the references. Introduction: Swarna Prashana. Swarna Prashana is a unique concept in Komar Bhritya, mentioned under various Lehana preparation. Swarna Prashana is the process in which gold is mixed with a simple or the medicated ghrita like Brahmi ghrita and honey and given to a children by a oral route. It is comprehensive rasayana chikitsa for physical, mental, intellectual, and the spiritual well-being of the children. Aims and objective: to study the concept of Swarna Prashana and its benefits from the Kashyap Samhita, and to study the various aspects of Swarna Prashana like indications, contraindications, age limit, doses, duration, and amount of Swarna Bhasma, and mode of action. Then whom to give means what are the indications for the Swarna Prashana as described in our Kashyap Samhita. There are given the shlok. I had given the points related to that. Dushprajata means preterm babies, postterm babies, and the prolonged labored born babies, LSCS born babies. Alpakshira Janani, Dukshara Janani means inadequate or the improper lactating mother's children. Vyadhi Pidita means neurological diseases like cerebral palsy, slow learners, developmental delay, and immunocompromised children. Then what are the contraindications? Contraindications are given as the acute or severe illnesses, liver or kidney disorders, organ transplant or the babies on the immunosuppressive therapy, malabsorption syndromes, and diarrhea, Now, what are the forms of Swarna we are using for the Swarna Prashana? Rubbed gold means what the metallic golds which is rubbed on the clean rubbing stone with water till the fine gold particles are released, given after mixing with honey and grita. Rubbed gold in but this rubbed gold in metallic form may causes the risks of toxicity. So we must have to use the Swarna Bhasma. Swarna Bhasma is the safer and mostly used now. Size of Swarna Bhasma particle should be 58 nanometer for the better absorption safety. Now, Swarnavacha. What is the Swarnavacha? It is the purified gold wire inserted into processed and the underground stem of the vacha plant and rub on the stone and given along with the madhu and the grita, which is mostly beneficial for the improvement of the speech and which is given in the patients with the cerebral palsy. Now, contents and its proportion. Suppose we have to make the 300 ml of Swarna Prashana, then what are the ingredients we have to take? Is Swarna Bhasma 1 gram, Gogruta or the any processed herb processed Ghuta we can take 100 ml, and the Madhu, Ghrut and Madhu we must have to take unequal proportion. Now, doses in the pediatric practices we must have to given the drugs to the any drugs in a specific proportion, so doses is important. Now, according to age there are the dosing classification. Up to 0 to 6 months means babies up to 5 kg we have to give the 3 drops, then 6 to 12 months 5 drops, 1 to 5 year 10 drops, and according to that Swarna Bhasma proportion is also mentioned there, and above 5 years we have to given 20 drops. Next slide. Here the form is means how we have to prepare the Swarna Prashana is given there. Next slide please. Now, scheduled. What are the scheduled means how we have to give this soon after birth. It has mentioned in our Jatamatra Paricharya, Jat Karma Sanskara in Kashyap Samhita, that is first dose we have to give in there. Up to 6 months, daily 1 dose, that is it has given that up to 6 months there is a maximum brain growth. So we have to give it daily. Then after 6 months, it is given monthly 1 dose, that is on the Pusha Nakshatra. Up to 5 years of age, rapid growth and development, and up to 12 or 16 years of age we have to given for the rasayana therapy. Now, what is the time of administration? Mostly rasayana drugs we have to given at the empty stomach, that is early in the morning, empty stomach before meal, so that there could be a maximum absorption of the drug. That means a Swarna Prashana. Now, what role of content of Swarna Prashana? That is, first one is there the Swarna Bhasma. Then what is the role of Swarna Bhasma? Swarna Bhasma is the considered as a Paramaidya, Rasayana, Sarva Vishapaham and the Grahapaham, immunomodulator activity, free radical scavenging activity, anti-stress activity, and the analgesic activity. Next, please. Role of Ghruta. Ghruta is considered as the Maidya, Ayushya, Vishahara, and the Rakshogna. Also, it is a rich source of DHA, which DHA drugs, DHA are given to the patients who are developmental delay, that is delayed milestone babies or the cerebral palsy patients. Importance for the cognitive functions, visual activity, and the overall brain development. Maintenance of the neurotransmitter level involved in the cell signaling. Next slide, please. Ghruta is the rich source of vitamin A, D, E, and K of the butyric acid. It is antioxidant, antibacterial, antiviral, and antifungal. Next slide, please. Role of Madhu. Madhu is considered as a Yogavahi, Bruhaniya, and Sandhananiya, antioxidative, antimicrobial, and anti-inflammatory. Next slide, please. What are the benefits of Swarna Prashana? Swarna Prashana in Kashyap Sahita, Kashyap Sutrasthan Leha Adhyay. As we all know that Leha Adhyay is a specification of the Kashyap Sahita. They are given that if we give the Swarna Prashana up to 1 month, then the baby become the Param Medhavi. Up to 6 months, that is Shrutadhara. Means whatever he can hear, he can recall, and his memory becomes very strong. Grasping power, sharpness, analysis power, and the recalling memory becomes very strong. Also, the immune system towards disease become very powerful. That is a Roga Pratikar Shakti. Next slide, please. It saves from various allergies and diseases occurring by seasonal changes, increase power to fight against toxin, that is pesticides in the fruits or vegetables which are commonly occur in those days. Now, improve the digestive power and prevents from the diseases during teeth growing phase. Uh, Mostly in the teeth growing phase, babies get sick very early. Increases physical power and the tones of the skin color. As the gruta is considered as the vernia. Next slide, please. Now, here in the picture form, I have given the benefits of Swarna Prashna. It is improves the intellectual memory, enhances physical strength, rejuvenates the baby tissue, and guards against the frequent infection. It promotes the digestion and the appetite. Next slide, please. Now, discussion. Stand. What we have to use is standardized Swarna Bhasma along with authenticated herbs, ghee, and honey should be used for the preparation of Swarna Prashana. Um, Use of Swarna Prashana all throughout the country by its incorporation in government schemes should be promoted by the Ayush. Can be used from birth up to the 16 year of age. Swarna Bhasma amount should be 0.5 to 2 milligram per dose as per the age. Next slide, please. And we can use it from the birth up to 16 years. Next slide, please. Here, conclusion is the we are given here is a immunization schedule given for the babies. Like vaccine of the modern sciences produces immunity against the specific disease, but the Swarna Prashna produces the non-specific immunity and in the more wide spectrum immunity. It is a comprehensive Rasayan Chikitsa for the physical, mental, intellectual, and the spiritual well-being of the children. So we must enhance the therapy. That is a Lehana therapy, Lehana Chikitsa in small children. Next slide, please. Swarna Prashana is a safe, efficacious, and should be promoted in every children for the proper growth and development. Next slide, please. Here I mentioned the references that I have used. Next slide, please. Thank you very much.
Thank you, Doctor.
Okay.
Next,
Thank you, sir.
Invite Dr. Shraddha Devrao for the paper presentation on the topic importance of Hedu in diagnosis of disease. Dr. Shraddha, are you there?
Yes, sir. Am I audible?
Audible, Doctor. Your voice is very low, Doctor.
Hello.
Just a minute, sir.
Hello, Dr. Sabin.
Yes, Doctor.
Actually, last that presenter has gone. Swarna Prashna.
Dr. Rashmi. Hello, Dr. Rashmi. Hello, Dr. Rashmi. Please unmute.
I think she's not there. No problem. Okay, doctor, you can continue. No problem. Dr. Sabin, you can continue.
Okay,
No problem.
okay, Doctor. Dr. Shraddha, please continue, Doctor.
Okay, sir.
Doctor, your voice is very low, Doctor.
Yes, sir. Yes, sir. Just a minute, please.
Okay.
Is my screen is visible, sir?
Screen is visible, Doctor.
Okay. Now my voice. Am I audible, sir?
Audible, Doctor. Please continue, Doctor.
Okay, sir. Good evening, everyone. My name is Dr. Shraddha Tsaure, and my topic is that importance of Hetu in diagnosis of disease. In Ayurveda, there are 5 means of diagnosis, that is Nidan Panchak, that is Nidan, Purvarup, Roop, Upashay, and Samprapti, which are included under Rog Pariksha. Knowledge of Nidan Panchak is not only for diagnosis of disease, it also gives information about prognosis, treatment, and differential diagnosis of the disease. Nidan describes positive factors of the disease. A factor which is capable of manifesting the development of disease either quickly or after a certain period is called a Hetu. Each component of Nidan Panchak helps to physician for better understanding of disease and treatment, but Nidan or Hetu is important for Nidan Parivarjan. It is an important part of the treatment to avoid the purpose for which the disorder has occurred. In Nidan Panchak, the word of Nidan means knowing the disease.
but it is not possible to treat you unless you know the importance of diagnosis in pathology. In some cases, a specific diagnosis seems to lead to a specific ailment. Example, eating mrittika in Mritbhakshanjanya Pandu, as stated by Charkacharya, one purpose can be the cause of disease, or for the same purpose, there can be many diseases based on the different places. Using the concept of Nidan Panchak, the physician can diagnose the disease at an earlier stage and hence can plan for the treatment. But Nidan is important for Nidan Parivarjan, which is an important part of the treatment to avoid the purpose for which the disorder has occurred. Here is my material and methods. Definition. Factors which manifest a disease is called Nidan. It describes causative factors of the disease. A factor which is capable of manifesting the development of disease either quickly or a certain period is called a Hetu. In other words, the cause of the disease is defined as the cause of the disease. Example, if person gets wet in a rain and then develops fever, then the rain will be the cause of the fever. Here are some synonyms for Nidan. And here are 14 types of Hetu. First one is Sannikrushta Hetu, cause which is near for the prakop of the dosha. For example, variation of dosha takes place routinely, that is during night, day, and during digestion, etc. Vipraprushta Hetu, it is the distant cause for the production of disease. Example, accumulated of kapha in Hemant Rutu manifest kapha's vikar in Vasant Rutu. Vyabhichari Hetu, it is a cause which is weak and unable to produce the disease but act as a carrier when favorable situation arises for the manifestation of disease. Certain factors decide to body immunity or manifestation of disease, that is etiological factors, doshas and dushas. Pradhanit, it is the powerful cause which produce disease instantaneously. Example, poison which causes death. Asatmendriya Indriyartha Sanyog, that is excessive utilization or non-utilization or improper utilization of sense object. Example, Chakshurendriya, Shravanendriya, Granendriya, Rasanendriya and Sparshanendriya with Atiyog, Ayog and Mithyayog. Pradnyaparad. Pradnyaparad means wrong utilization of speech, body and mind. Some says even sinful act also responsible for intellectual blasphemy, that is Sharir Mithyayog, Vak Mithyayog and Manas Mithyayog. Kal. Kal is known as a transforming or consequence. Kal is the unit of a time comprised that Hemanta Rutu, Grishma Rutu and Varsha Rutu characterized by cold, hot and rainfall respectively. Example, Kal Atiyog, that is extreme cold in winter. Kal Ayog is no rainfall in rainy season. And Kal Mithyayog is no rainfall in rainy season, but there will be extreme in winter. Utpadak Hetu and Vyanjak Hetu. Utpadak Hetus are those which favors accumulation of respective doshas in respective season due to change in season. For example, in Hemant Rutu, due to Madhuradi substances, accumulation of kapha observed, and Vyanjak Hetu are those which stimulates the development of disease. For example, accumulated of kapha in Hemanta manifest disorders for kapha in Vasanta due to effect of sun. Two more, that are Bhaya Hetu and Abhyantar Hetu. Bhaya Hetu are diseases manifest due to consumption of various abnormal diet, activities, effects of season and such other internal factors which are responsible for the development of disease are called Bhaya Hetu. And Abhyantar Hetus are internal factors which disturbs the dosha and dushas are called Abhyantar Hetu. Diagnostic importance of Nidan. To avoid the causative factors which are responsible for cause of disease, and it is primary step to prevent further pathogenesis and complications, that is Nidan Parivarjanam. Planning specific treatment in each and every case of line of treatment will be differed and it will depend on the causative factors. To know the chronicity of the disease, example liver cirrhosis has a history of consumption of alcohol for long time. Knowledge of Nidan helps in prognosis of disease, that is Sadhya, Krucha Sradhya or Asadhya. Discussion is each component of Nidan Panchak individually as well as collectively helps in diagnosis of disease. Thus, we have to know the diagnosis according to Ayurveda, which helps in diagnosing a disease and treating the patient in a proper way. My conclusion is Hetu helps in knowing the actual cause of disease and helps in a main treatment, that is Nidan Parivarjan, helps to know the chronicity of disease and helps to know the prognosis of disease. Hence, we can state that knowledge of Nidan is a milestone in diagnosing a disease and treating the patient in a proper way. Here are some references. Thank you.
Next, we have a paper presentation on the topic, a clinical study of Vaishwanara Churna in management of Amavata. And for that, I invite Dr. Rishikesh Sridhar. I invite Dr. Rishikesh. Dr. Rishikesh, are you there? So next I invite Dr. Shivani Phavarekar to present the paper on the topic, a review on Nitya Sevaniya Ahara.
Hello, am I audible?
I invite Dr. Yes, Dr.
Hello.
Shivani.
Yes, just a minute. I'm sharing my screen.
Yes, you are audible.
Yes, okay. So hello, is it visible?
Doctor, please share the just click the link. Your folder is not open yet.
Is it not open yet?
No, doctor.
Let me do it again. Is it visible now?
No, doctor.
Doctor, please turn on your PPT, then share the screen, doctor.
Yes, I've done that only.
Once again, please cut the screen share and once again retry, doctor.
Okay.
Turn off the screen share, then turn on your PPT, then share the screen, doctor.
Is it visible now?
Not visible,
Hello?
doctor.
Is it visible, sir?
Not visible, doctor.
No, doctor.
Doctor, once again, please share, doctor.
Share screen. Is it now? I've done that again.
Only shows the desktop file, not show the PPT.
Oh, not showing the PPT. Okay. I've put in the screen mode. Is it visible now?
No, doctor.
Sorry. What is that thing? Is it not? It's not. It's not. It's not.
Doctor, now it is visible, doctor.
No, sir, it is not the one. I just wanted to check, is it sharing or not?
Okay, okay, doctor.
Where is it gone? Sir, I'm unable to share this. Can you give me some time?
It's okay, doctor. You can present later.
Okay.
Please be there.
Yes, yes, I will be.
So next I invite Dr. Vishnupriya Sitaram for the presentation.
Hello, ma'am.
Good evening, doctor.
Good evening. Am I audible?
Please start. Yes, yes. You're audible.
Ma'am, is the screen visible?
Yes, doctor. Please start.
Namaste. Myself, Dr. Vishnupriya Sitaram from the Department of Kai Chikitsa, finally a PG scholar from SDMC Udupi, is going to present a topic entitled Compilation on Gokshurati Gugulu for Clinical Practice. So here there is a sloka mentioned in Sharangadhara Samhita Madhyama Kanda, chapter 7, Vataka Kalpana, where he explains about the preparation of Gokshurati Gugulu along with the indications. So when the indications are said, it is told that Hanya Prameham Kritsrancha Pradaram Mutra Ghadakam Vatasram Vadarokascha Mutra Shukra Dosham Tadashmari. So these were the indications that was told by the Acharya. Nowhere in the sloka there is mentioning about what anupana to be used in this formulation, but it is left to the physician to choose the anupana based upon the yukti. So this paper gives an insight towards that. So let us move on to the ingredients of Gokshurati Gugulu. Here, maricha, pipili, haritaki, mustaka, Gugulu, Gokshura, amalaki, vipitaki, and shunti are the ingredients of this formulation. When we move on to the Rasaguna Virya Vipaka of this drug, it is of this formulation, it is found that most of the drugs are from Ushna Virya drugs, and considering the Vipaka, it is considered that most of them are having Madhura Vipaka. So the Doshaknata is like either it is Tridoshaka or it is Vata Kapha Shamaka. So these are the phytoconstituents of this formulation. So when we are taking a combined action, like how was this formulation exactly acting? You can find that Muska is a very good diuretic, analgesic, antispasmodic, anti-arthritic, anti-inflammatory, antipyretic, analgesic,
and antioxidant, antimicrobial. So these kind of actions are there for musta. Similarly, most of the other drugs are also having anti-inflammatory, analgesic properties, and even hyperlipidemic, hypercholesteremic actions for gugulu, and some drugs like pipali inhibits the inflammatory mediators like interleukin 6 and prostaglandin E2, and vibeta K has a separate effect, like it is a very good nephroprotective, and such kind of actions are found in this formulation. So there has been various researches done in this formulation. So first one is about the evaluation of antimicrobial activity of Goshadi Gugulu on urinary tract infection. So this was a study that was done by Dr. Ravani Siddhappa. So here it was found that this is acting very good upon all the microbes that cause the UTI. So that was one finding. And the another research that was done by Anubha Chandla was about the efficacy of Goshadi Gugulu and Varunati Kwata was the Anupana used, and it was done for the management of renal calculi and ovarian cyst. So the treatment was done for about 8 weeks, and it was found that even by the first week itself, there was a significant improvement in the pain, abdomen, and also dysuria symptoms that the patient had. And after 8 weeks, a repeat UST was done and it was completely fine. So this was another study that was done, and it was based on further spermatogenic and aphrodisiac potential of this drug. So there was basically two kind of studies that was done. One was on the biochemical evaluation, and the other was the histological study. So in biochemical evaluation, it was found that there was an increase in the serum testosterone levels, and it was like 0.001 was the significance level of it. And when the histological study was done, it was found that there was enlargement of the seminiferous tubules and presence of Sertoli cells and Leydig cells, and there was different stages of spermatogenesis. So this gives proof that it is also effective in the Shukra dosha vikaras and all. And there is yet another research that was done by Rimlijit Kaur, and it was done on Goshadi Gugulu along with different anupanas for the management of gout. So one group was given with Goshadi Gugulu and warm water, whereas the other group was administered with Goshadi Gugulu and this Guduchi Kwata. So the second group had got more effect in the reduction of the symptoms pertaining to the gout. So that was another research that is justifying the indications mentioned in the sloka. Another research was done on for the chronic prostatitis or chronic pelvic pain syndrome. So here also there was two groups for the study, and one group was given with the antimicrobial therapy and other therapies pertaining to the conventional science, whereas second group was administered with the standard Ayurvedic therapy itself. So they were given with the Anvasana Basti and Astapana Basti and some oral Ayurvedic drugs. So the Anvasana Basti was given with the Narayana Taila, and Astapana Basti was given with Dashmula Kwata mixed with Narayana Taila. And in oral Ayurvedic drugs group, it was found that they were given with Kokshati Gugulu and Varuna Shigru Kashaya. So when the patients were treated for about 21 days, it was found that the Ayurvedic group, Ayurvedic therapy group, had found more significant results in the improvement of their symptoms compared to the other one. So this was another study. It was just a conceptual study based on this Goshadi Gugulu. Sorry?
Please continue, doctor.
Okay. So this was a conceptual study of Gokshradi Gugul in Mutravaha Srodo Dushti Madmeha with special reference to diabetic nephropathy. So they justifies how it is going to act upon the renal cells. So that is just a conceptual study. And another study was done in the treatment of primary open glaucoma. So here it was given with Ashodhana, Tarpana, and the medication was also given. This Punarnavashtaka Kwata along with Kokshadi Gugulu was given. So there was a result in the other group, which it was administered with Tarpana and Ashodhana. But I'm just justifying that this Gugulu can be given with this formulation in the management of this disease. Another research article was done in Gokshadi Gugulu and Guduchi Koda was given. For Guduchi Churna was given in the management of type 2 diabetes mellitus, and it was found that it was having very good effect in controlling of this type 2 diabetes mellitus within 84 days. So that was one finding. And this was another study. It was long back in 2005. It has been done, and it was on chronic filariasis. So here it was given with Kanchananda Gugulu and Gokshadi Gugulu was given together. And it was found that most of them had relief from the lymphadenitis, lymphangitis, lymphedema, tenderness, fever, heaviness, and rigor. And even there was significant results in the reduction of ESR levels. So that was another finding. And yet another research was done in polyhydramnios condition. So here there was Gokshadi Gugulu and Varunati Kashaya was given for some days, and it was found that the lady didn't have polyhydramnios condition and she delivered a normal baby. And this was another research done by Dr. Mithuna Sri, Dr. Rama Devi, and Dr. Arpana Jain, where there was different formulations, like 2 groups were selected, and out of them, first group was administered with Ashoka Kshirapaka 50 ml along with Gokshadi Gugulu 1 gram BD, and group B was given with Musli Kadriadi Kashaya 50 ml along with Gokshadi Gugulu 1 gram BD for 2 months. Both were given. Out of them, it was found that both of them had act significantly well in the reduction of the symptoms of this consistency, or whether it is a generalized weakness or the duration of the menstrual flow or the blood loss that has been found, or clothes. So everything, both of the group had significant results in the reduction of all these. So that was another study done in Asrigdara. So while to conclude, I would like to say that Gokshadi Gugulu acts in the reduction of the symptoms and signs that are pertaining towards the Adokaya. So mainly it is controlling the Apana Vayu that is present. So when we go into the indications of this drug, whatever indications that the Acharya has been mentioned, most of the research studies have been done in this regard, and it justifies the same. So that is the conclusion of my paper. Thank you.
Thank you, doctor. So now we have our final participant. I invite Dr. Rishikesh Sridhar once again for the presentation. I invite Dr. Rishikesh. Hello, Dr. Rishikesh, are you there?
Hello, Dr. Rishikesh. Hello,
Yes,
doctor.
sir. Audible, sir.
Doctor, please.
Doctor, please start.
Doctor.
Sir, share PPT, sir. कुठे गेली PPT आपली? कुठे PPT? दाखवून असं. Hello, sir.
Hello, doctor.
Yes, doctor.
I am unable to PPT. Share PPT, sir.
Doctor, can you send the PPT to my WhatsApp?
WhatsApp, go. Okay, sir.
Hello, doctor. I will share for you. 1 minute, doctor.
Sure.
Doctor, please start the session, doctor.
Sir, good evening, sir. A clinical study of Vaishnav Churna in management of Amwat. Sir, next slide, sir. Presented by Dr. Rushikesh More, MD Cardiac Scholar, Estimated Ayurved Mahavidyalaya Rahwari, guided by Dr. Anil Pansambar, Associate Professor, Department of Kaichikisa, Estimated Ayurved Mahavidyalaya Rahuri. Introduction. Ayurveda originated to fulfill main purpose, maintaining the health of the healthy or normal person and curing the alignment of the ailing. Amvat is made up of combination of Am and Vata. Am, according to Ayurveda, Am is caused due to malfunctioning of the metabolic mechanism. Vata is chief functional operator of all types of voluntary or involuntary movement of the body. Whenever the function of Agni is distributed in body is produced, this producer along with the Dushti Vata circulate all over the body through Sira and Dhamni and gets lodged in Sleshmathan, that is the Sandhi joint. Vaishnava Churna contains drugs as Yavani, Ajmoda, Shunti, Haritaki, Lavan that have properties like Koturas, Ushna, Virya, which acts as appetizers, and Pachan of Am, hence helping relieving Shot and Shul. So Vaishnava Churna recommended in Amvata. Abstract. Ayurveda, an ancient system of medicine, explain well about joint disorder like Vatrakta, Sandhivat, Amvat, etc. Among these, Amvat is a disease which is caused due to hypofunctioning of digestive fire. Rheumatoid arthritis is the disease which keeps clinical similarity with Amvata. Am is the main pathogenic factor in the disease Amvata. Factors causing formation of arm have direct impact on gastrointestinal system. So GI regulation is the mentality of Ayurvedic therapy in Amvata. There are mental factors to which cause formation of arm and hence the disease. Modern system of medicine use anti-inflammatories, immunosuppressing agent, but these drugs have bad impact on the quality of life, have so many side effects. So next, sir. Ayurveda also emphasizes on healthy lifestyle and dietary behavior to check the pathogenesis of the disease. There are research which prove that an Ayurvedic line of management is a better way to improve quality of life in an RA affected patient. A female patient of year 45 having symptoms of Sandhi Shulani Sandhi Shot since 6 months. He had already taken various treatment. Vaishnav Churna was done on him by weekly interval. In first week, Sandhi Shot and Sandhi Shul reliefs 25%. Changes in movement is 20%. Second week, Sandhi Shot and Sandhi Shul relief 45%. Changes in the movement of 45 after 2 weeks. Patient asked for follow-up after 1 week. At the end of third, Sandhi Shul is about 60%. Changes in movement about 55% assessment in relief in is sign and symptom was done by weekly interval. Keywords Amvat, Vaishwan Churna, Sandhi Shul and Sandhi Shot. Case presentation 45 years old female housewife with complaints of Sandhi Shul, Sandhi Shot, Daha Agnimandya, past 2-3 months. She present requesting treatment for this pain. The patient taken counter anti-inflammatory and intermittently, which have provided some relief. On physical examination, she had a Sandhi Shot to palpation in the region. The remainder of the examination was unremarkable. After she was diagnosed with Amvat, the patient was given Vaishnava Churna in the following manner. Sitting following up after 15 days. After the first sitting and second sitting of the Vaishnava Churna, the patient get relieved from the symptoms. After third sitting, she get completely relieved from the symptom. During follow-up period, also there were no complaints. Discussion. Amvat is made up of a combination of Am and Vat. Am, according to Ayurveda, Am is caused due to malfunctioning of the metabolic mechanism. Vat is a chief functional operator of all types of voluntary or involuntary movement of the body. Whenever the function of Agni is distribution in body is produced, this produced Am along with Dushti Vat circulate all over the body through Sira and Dhamni and gets lodged in Shismathan, that is the Sandhi. Vaishnav Churna contains drugs as Devani, Ajmola, Shunti, Hartiki, Lavan that have properties like Katura, Sushna, Virya, which acts as appetizers and Pachan of Am, hence helping relieving Shot and Shul. So Vaishnav Churna recommended in Amvat. Concluding the drugs of Vaishnava Churna in patient of Amvata, its action on Ayurvedic Siddhant as a whole on the basis of the initiate properties. It can be concluded from present work that in patient of Amvata, the use of Vaishnava Churna is capable of producing significant symptomatic improvement and can cure the earlier stage. So next, references. Thank you, sir.
And so that's the blend of presentation and really well. So our final presentation will be on April 2nd, Saturday. And for winding up the session, I would like to express my sincere gratitude to our panel member, Dr. Ashwati S, for being there with us. And thank you all. We'll meet Saturday.